Morning, this is Leonard. Any HES members called in yet?
I just
Cheryl Yazzie.
Thank you very much. Any HES members online yet?
Good morning. This is Lorenzo Max from the Nahataki Association. I was just wondering if we were on the agenda, and if so, can somebody email me an agenda?
Shananda, I think we're just put on hold.
Good morning. I'm sorry. From what entity are you from?
The Nahataki Association. I'm the vice president.
Okay, let me check the agenda. You can find it online at www.navajonationcouncilmeetings.org, and you'll find a list of meetings. But let me check on the agenda for you, Tehan.
Okay.
Good morning. I just looked at the agenda and I don't see your company, your organization on the agenda. However, when the meeting does commence, if you have been speaking to a delegate, you might want to convey that with them as well.
Okay. Yeah, we've been talking with Daniel So, and I'm just wondering if he was online.
Presently, there are no delegates on the line yet, but they should be calling in momentarily. As soon as he does, you should be able to hear him.
Okay, so how do we proceed with that? Do we just ask to be recognized and be put on the agenda, or
For now,
since
hold
this is all online?
Chairperson Daniel So will acknowledge it. So as soon as he gets on the line, we can proceed with that, and I'll notify him as well.
Okay. All right, so he's the chairperson.
Thank you. Yes,
Hola,
he
thank
is.
you.
Oh,
Thank you.
thank you for your patience, and just continue holding.
Good morning, Sherilyn.
Yes.
Yeah,
Good morning,
I'm
Samantha.
gonna-
Yeah, this is Delegate Helona. Are we started the meeting yet? I just now got on.
Sir, this is Leonard. There's only three so far. Yourself, Honorable Albigay, and Honorable Wanika. You're both here in the conference room. So you're number 3.
Okay. Oh, there's somebody else on.
Charity, hi, this is Leonora Henderson. I have an appointment scheduled this afternoon and I won't be able to make it.
Who is this again?
Can you try Thursday or Friday in the afternoon and then just send it to me?
Leonora, Leonora, please mute your phone. We can hear your conversation.
Sorry.
That's okay.
Good morning. This is Ramona from the Navajo Epidemiology Center calling in.
Thank you, ma'am. It's Leonard. We're just waiting for the rest of the Hess members to call in. This whole site. Thank you.
As I'm on standby, just want clarification. On the agenda, it has 10 o'clock, and on the email notice, it has 1 o'clock, and I just took a chance to call in at 10.
Yes.
Can you clarify, does it start at 10 or does it start at 1?
Starts at 10
The
o'clock.
health education.
We're just members for quorum, ma'am. So this whole
All
site.
right. Thank you very much for the clarification. Yeah.
You're welcome. Oh.
Carlos Slater.
All right, sir, you make number 4 to make a quorum. Vice Chair, you hear me?
Can you repeat that?
You're the fourth member to call in, so you and Honorable Halona online, and here in the conference room is Honorable Paul Begay and Honorable Edison Monica, so we have 4 to make quorum. Still waiting on Chair and Honorable Charlito to call in. We do have a quorum now, if you want to start the meeting.
Okay. Have we heard from Chair indicating whether he'll be on presently? Well, I'll go ahead and call the meeting to order. It's 10:23. We have 4 members, I believe, on the line or in Window Rock. Can we do a roll call, please?
All right, sir. Roll call for Health Education and Human Service Committee, 24th Navajo Nation Council, regular meeting via telecommunications, June 10, 2020, 10 a.m. Honorable Paul Begay Jr. Present. Honorable Carl Russell Slater.
Present.
Honorable Pernell Halona. Honorable Pernell Halona. Honorable Charlene So.
Delegate Halona is present.
Okay, thank you, sir. Honorable Daniel E. So. Honorable Daniel E. So. Honorable Edison J. Winika. Here. Vice Chair, we have 4 members constitute a quorum.
Thank you very much, Mr. Mose. Whomever is making a call right now, can you please silence your phone? Delegate Paul Begay, will you please provide an invocation for this meeting?
Ready to go, sir. Huh? Ready to go, great. We're live.
Okay, thank you, committee members and those that are online for today's meeting. We shall bow our heads and give thanks for a new day. The Health Education and Human Services Committee was here. Kinani Kado Saia Dishbeh. Ego Hadago Shishnada Nilnato, not Abeni Yakwa. Banaho Adi Benedict at John Quaya at that evening. Ado she had laid on Jungle the Islas, though Hadi Ni Ado Dea Nin Jungle Chana, that's in his one lord. She sat that Edo, not Ada, Sakis, not a so. When he caught the lost, yet he's not a deal, even a Jacon, he didn't be. They were caught not the lost on, he didn't yet echo ear, the snow's on so he didn't decon, the never carry a card, the meal, so a key heart, so on his no, because echo behind that key you, so so late your torch door was to how so. I don't know why Colorado to do at Equia. Mrs. Arnold, so they call. Though I have no country for ICT national and given so they don't judge your partners. Yet, a half of the other don't he can't Disney for this. I don't hear and how the distinct. Benada he had what that was kiss a cop and the car was being got. The north of the bent og sisto be sigi da berto si bent og sigi di shingi do berhazan hat ni go ibahan ko begin dort kato even na ke na di atefo tengi bindi ka ni so di ko na the never ke ka o kidnap
Daniel Stowe.
Delegate Charlene So.
Ani so konche yana da to da so ni ka beteni lengi do da nani sun ko hotem si khaza aroni sun so ni ka ya na khait kitna ba ko liya do le khishin le na ta ba ni sitiat ni go ta ba na ta ba ni ki do astatina halon di da to pen stenel ni do le khishe bet da so sa de bet hati bet khayana ho te do le si ho te go ya paso dilsen ha do ya te ho ya kitna ado le khishe ado na so jishko nas des kabo an khon londo ha khaliya so ya di pen be get so body ni do so the zen ilia do ya your Jesus Christ the natural is of Jesus. Amen.
Shania, Delegate Stowe, Chair, we had proceeded and made it to the invocation, which Delegate BA just provided, and now that you're on, I think you can conduct the meeting.
Kushila Sitsili. Ado Kaskusazani those kids and honorable committee members of the Health, Education, Human Services. My phone was on the blink for a good 15 minutes, so I finally got it restarted, and I think I overloaded it with a bunch of phone calls and whatnot. But the other is, and thank you, Chiche, for providing that invocation. In our work, we hope that we have the knowledge and the wisdom and the energy to face all these issues that come before the committee as we go forward in our work. Cool. Committee members, do you have any announcements? I guess that let the record show that Ms. Honorable Charlene So got on the call at 10:28, as well as myself. What committee members, do you have any announcements? And then, if there's none, then let's go to recognizing guests and visiting officials. And I will ask the committee's indulgence also. The Dene Hatasi Association, last week they prepared a
Carmelia Blackwater with Twin Initiate Shelter.
Okay. They had prepared a budget for submittal to the expenditure plan, and using part of the CARES Act money. So as we go forward, we would like to include that as a report and a request for the Coffee Association. Also, regarding a follow-up from Jody on Cassie and White Runs. See what the other issues they've come across. With AILA committee members. So we do have, the other is the legislation that is passed the Resource and Development Committee that comes forward to us. The legislation to cancel all fairs, rodeos in this coming season. So that would be another item that we would need to add to the agenda with AILA committee members. Could we then have just through an announcement, have the folks that are on the call just introduce themselves, name and in that aspect. Thank you.
Good morning. This is Maggie Benali from the Department of Education.
Good morning. This is Lorena Hallwood from Adabi and Chinle with the Women's Crisis Program. Thank you.
Good morning. This is Carlisle Begay, Federal and State Government Affairs Advisor, Office Speaker, 24th Navajo Nation Council. Go ahead.
Good morning. This is Teresa Warren, Executive Director with Alice's Place.
Bennett Carmelia Blackwater with Todanesha Shelter in Kayenta, Arizona.
Good morning. This is Leonora Henderson with Daltex.
Good morning. This is Alexander Tarbit with Classic Air Medical.
Good morning. This is Lorenzo Mack, Vice President of the Nahatali Association. I'm joined by our President, Dr. David Johns, and Secretary Dr. Michelle Kahn, and also our advisor, Dr. Mandy Begay.
Good morning. This is Ramona Antones with the Navajo Epidemiology Center, joined with David Foley and Dal Yazzie, epidemiologist. Good morning.
Good morning. This is Brian Lee with Congressman Lujan's office in Farmington.
Good morning. This is Wade Patton. I'm Chief Administrative Officer with Classic Air Medical.
Good morning. This is Jonathan Harrison with the Office of the Controller, Contract Accounting Section.
Yeah, this is Brian Johnson. I'm also from Office of the Controller, Contract Accounting Section. I am an Associate Accountant. Thank you.
Good morning. My name is Valerie Hubbard. I'm the Accounting Supervisor with Contract Accounting, Office of the Controller.
Good morning. This is Darlene Juan from Roberta's Place Shelter.
Hi, good afternoon. This is Marquis Yazzie, Office of Tribal Program, Indian Health Service.
I got on at 10:30.
Okay, does that pretty much take care of our introductions of the visiting guests and officials that are on the call? If that does, then committee members and staff, Ms. Martinez, Mr. Mose, we'll go on to reviewing and adopting the agenda. And again, to indulge the committee members to include the report and request of the Nehatahi Association, and also discussion on the matters of Chincoteague Community School, as well as the Chippewa Alternative Schools Incorporated. With AILA committee members, Ms. Martinez, could you review the agenda?
Good morning. Agenda of the Health, Education, Human Services Committee, 24th Navajo Nation Council, regular meeting, Viva Telecommunications, June 10, 2020, 10 a.m., presiding Honorable Daniel E. So, Chairperson, Honorable Carl Russell Slater, Vice Chairperson, Place, Budget and Finance Committee Conference Room, Viva Telecommunications, Window Rock, Navajo Nation, Arizona. 1, call meeting to order, roll call, invocation, announcement. 2, recognize guests and visiting officials. 3, review and adopt the agenda. 4, review and adopt the journals, April 29, 2020, May 13, 2020, May 20, 2020. 5, receiving report. A, report on its emergency air transportation program. B, update report from NAIHS regarding Northern Shiprock area COVID-19 issues. C, update report from Navajo Division of Social Services regarding shelters. Report from Navajo Division of Social Services on strengthening family program, funding federal grants, SVBSA. E, update report from Navajo Department of Health on Daltech Senior Centers, and update report from the Epicenter regarding COVID-19 data. 6, old business. A, legislation 0295-19. Note, main motion held October 16, 2019 by Honorable Paul Begay Jr., second by Charlene So, vote pending for program to correct Exhibit A language to include Navajo Nation Board of Education resolution and updated organization chart. 7, new business. A, legislation 0046-20. B, other. 8, close the meeting, announcements, adjournment. Mr. Chair and committee members, the agenda has been read into the record.
Committee members, back to you.
Motion, set the agenda. Any changes?
Who was that yelling?
Let's now get on a motion.
There's a big echo in the from where you guys are at. I didn't catch everything. Ms. Martinez, can you I guess relay who made the motion and who second?
Pernell Valona made a motion for agenda, and there's no second. Chairman.
Second was Paul Begay.
That didn't sound like Paul Begay.
He's too lazy to get up and walk over here. Second by Paul Begay.
Okay, all right, Che, we'll recognize the second. Committee members, as I stated, I'd like to include the Nehatahi Association report and request, the update on Wide Ruins Community School and Shiprock Alternative Schools, as well as the legislation that is sponsored by Honorable Chair Eugenia Charles Newton regarding the cancellation of the fairs and rodeos during this summer and fall season. Committee members. Those three items.
Yes,
Chair, I motion.
We can add those on.
Okay.
Chair, this is Delegate Slater. I have a request to that motion.
Yes, go ahead, Cecilia, Honorable Vice Chair.
My only request is just that the Hitates Association would be the new item 5A, and then we'd re-letter thereafter.
Okay. Committee members, a request to moving party.
That's agreeable, sir. Yes, thank you.
Okay. What about the three requests to add on the items?
Yeah, we can add those on if they're ready to go. I know the legislation for the fairs is ready.
Okay.
Yes, we can add those, include those to the agenda.
Thank you. Moving parties, Honorable Halona and Honorable Begay. Committee members, you've heard the motion to amend the agenda that was read into the record. Mr. Mose, could we do the roll call vote?
Yes, sir. Honorable Paul Begay Jr. Honorable Paul Russell Slater.
Green. Thank you.
Honorable Pernell Halona.
Halona votes green.
Honorable Charlene Stone.
In favor.
Honorable Edison J. Winika. Chair, we have 5 members voting green.
Okay, thank you, Mr. Mose. Then let the record show a vote of 5 in favor, 0 opposed, and chair not voting. Then we go to reviewing and adopting the journals of April 29, May 13, and May 20. And those journals, word for word, were sent out earlier.
This morning, sir.
Yes. Mr. Mose, go ahead.
Yes, sir. I emailed them out this morning.
Okay, what's the wishes of...
If there are no questions from the committee members on the journals, I'd like to make a motion to accept the journals.
Okay, any questions? Then motion to adopt the 3 journals by Honorable Halona. We have a second by Honorable Edison Winika. Any questions, discussion? If not, then all in favor. Mr. Mose, roll call vote, please.
Yes, sir. Honorable Paul Begay Jr.
Here.
Honorable Carl Russell Slater.
Slater, green.
Thank you, sir. Honorable Pernell Halona.
Green.
Honorable Charlene Stone.
In favor.
Honorable S. D. Winika. Green. Chair, a vote of 5-0.
Okay. Thank you, Mr. Mose and committee members. Let the record show 5 in favor, 0 opposed, the chair not voting. We'll go to item 5A, receiving a report. With the amendment, we have a new A, report and request from the Nehatati Association. Quagila, Mr. Lorenzo Max, Dr. David John, and Michelle Conjohn, as well as Mr. Manley Begay. You're up, so whoever wants to go first. Committee members previously.
Yat Eho. Everybody hear me okay?
We can hear you fine.
Okay. My name is David Johns. I'm the president of the Nahatati Association. I think my vice president, Lorenzo Mack, is on the line. Our secretary, Michelle Conjohn, and our advisor, Manley Begay. I don't know if there's some others that called in, but I'm glad that we're all invited today to this teleconference. And I just want to briefly just kind of say that a little history about the Nahatati Association, the organization, when it started, and it started back in 1970. As you have read the proposal, it's all in there. And this is the same organization that got started in 1970. So I just want to let that known, and it's still going. It's all voluntary basis. We don't get paid for going to the meetings. We don't get paid for doing what we've been doing. So this is all voluntary basis. So I just wanted to bring that out. And on kind of this pandemic, and there's a lot of setbacks on our part with the medicine people, with the Hatasis. So, but we heard about this funds, and we did a proposal. So I just wanted to say about that much. Hopefully we get funded. And I'll have my vice president to say a few words too. I'll say about that much. Yat eto kehe.
Yat eshanan ano senigi ide Lorenzo Max kusne ato recording nash es kapa das je tediski das she thodchi das nale ik agit ego yat e ano sko out of Quentin House, honorable chairperson and honorable council delegate. A coco, he called the Ayaha, Ziggy Jordan, a coffee, Mihananish Enils, and Gij, England, Benasi, Kahagi, J.A. Arpati, Nekot, and Natali Association. Ado, Nihinahagato, Nihisotzen. In our state, Agni, J. Bahulia, Kitini, what ego, J. Able cheese, Bahayat, in Kitashi, this cheat and the door you need in Naharachios, Esselvenchios. Kako, it's Bahayat ego, what are a Hanidia, Nihitsito, Ninsectis, Nihin, also, a Bayat. So in other words, it's our first healthcare system. Ako itay to IC yego to never nada. Ako kwanza te yego na hui nasali. Ako ayudin nahi na nan cheto ye nahi di ka ot ego. This gene debate ilte ako te Doidasi Hazo, Bakohin, Zindasili, by a lot of our people. What aid J. Hanepa Holoto, or history, later at the hot in Donasa, the sacred events in our history. Jada is in Yahadatit. So our songs are like books. Our ceremonies are like books. They are our ancient texts. Our ancestors, they preserved and kept that safeguard. So these there are knowledge holders and Ako ahat the Nabakati was needs and what in the face of Atapo or Nihi then. They hold just Sagahot Sanda to a base of Latin hate after. So what and here been yak in that the Kido up in Yan de Kai. I yego be Jolgate land now wins in. Jokai proposal, they had it aggregate up a car. What a machine happen, set of Coso, Nahatape, Latinos, a bin Yada, Naoka, Abo, Ego. A quiet Sartan Linibe has speed or lip, shit and Nashik aim of Liniki, quite orly, on it.
Michelle John, are you there? Manley Brigade?
That educator, Negos and Anna City, are questions and finish Manley Alan Brigade Junior, that's just me. I call Net House Association with the AKA RJA Shananish Nat the Ahasans talk. Sketa the Kushina Kayata he can't deal with she taught me. Call Ita and Tucson, Arizona, the other Shagan, the other Shananish Nat eating that call. Now, Latin need a call policy advisor. He don't need to put up. This change it could you Shananish Nat eat Shanant Arosha Tati, Arjabanash that he got up. The car not sure for this another Nidiki Lorenzo Dovi Shana David John and Nidiki non-nations he like us land at those are pesos a hatan soda yard the history is sort of the Sabahot Sando Ado Tahikaki what are at what are pesos and hatchet at a Katinta Koto Nasnegi Benina she had Hasidan Ledigi Hasil so bananas and Sadas Ling for the Halaki Nasnegi which is it then Hatne Corn Petty Koto the neck at your bansa Keo as a hollow Adoti Nasnegi Abba Hasan ye Hasil so we could yes, that the tin later, I just out to us, it out bears and the call. I don't keep it, Zaggy, how long what out, what they don't out. He and I done many doggy, he had half it done Zilly, what are you get at this name? A call ain't naughty, and he had hardly hasn't so bananas and Sada's name. Called I quit Jim Codo, he now. I quit Chicodo, he can't get done. وأنا لان سنتي كتون هي تاني عندي تهلو هذا خاشين ساعتي بسوش خجدان دلكي كت بتخافي تا أتاستين بأوتي ساعات تنهارش بعداتي ده أدوتي هزاركي عندي بياتي كي أدوتي أخاشين سودي يهنان تادي هي تخافي تنزلكي ده أخادي تادت تستأيي كهو أكو بتشي يكاسة يكاسة يتبدي نيسة لا يكاسة تبدي نيسة وتا نكا أنت الوقت كديش تكون أو أشبيه عندي كتاسي خصص يهنان تان أكو إلا بالناشنا كدو أخاشيل صودا كدو تيدا دي ناس صوصلا حتى تديا أكو تيلا وتا لا أخادن صودا يتخافي لا يمكن لنا يكاتو الوقت إلهم كدو وتا حتى تديا نحن وليهكي توتي صدزن وليهكي توتي خاشين صوتي نحن تيوك هيديكي ببكاتو وحنا أدوتي نحنيكي بنينا لادي نحن خاشي توتون تحسادا ونهاغادا نو وحنا أدوتي كدو خاشين شهكو يا بجي انتهى إيه就是零，好的，我打不卡到我他弄那好多打错那还得得呀，第三个也的，然后也都的错的人的也的的本呀，啊都那结果呢的也难听了也的那个是难听的的COVID-19 我也的可是一个啊这个难听的哈的是那是那个都啊这个的一个都。which is that ehekito alle and here all is nature hada in lendigi digila e penan kindole no hadati nihetina hashi so jeda hui na aya go which the host di ko hashi so di kudola he khasila Espeta hazliki na haga yegi toti soduzenda yegi toti nan kinu yegi ARGT jo hitne espeta hazlendo de non da hoto na so da ka de ya ko behazeno ka ako di kodola empowerment protection prevention do proportionality, partnership, accountability, self-care, self-healing with yegi dibaskada kachigi ila la bansa kesala na sosa hatilia nihe khasila di la ta sen sesno la hatatia kalati ben sekkesi ne ben sekkeso hashis mental yegi psychological anguish yegi spiritual health impact inda kodola patan hinna ona kodola be hadan soda ti kodoya la spiritual la kodola hito lisa alone la hotana so be hadadia ado ti salen ti yati le the 5 agencies the kodo hashin na dan he had это хатсе эна то ян ахатал сода пето ни аже пато вот дедиги вот на халати то Washington DC вот едо хасу so paycheck protection no атия for the хасу so не пата вот доллар я хатила вот на пата вот no Kana so sabakati ya. Ko the kana the proposal had that ya halati the pandemic mitigation yegi this is a net ban sa ke so ya sa ina patona a diagnostic yegi ina sa yola be ho si akhida da kitna which not hospital. Auto prevention, that or safety. Auto protection, that or safety. Or purification, or restoration of harmony. Ako the mitigation CDC mitigation measures the opposite the next case. Edo ahadan so the na hajo but hasn't on that that the no land not so stop the party ya. Ako the kodo ni na hasn't so much that na. Ako hajo ya tio. Hajo na da has no. Ada ilan se wedan le dos yashitan le ko di could only radio be yashita newspaper to be yashita ta not so sa ta yedo eda do social media to be eda jobchi ya be do jobchi ya tio even na che ada ino snippet no la la jola natika ati no yet hari pesota not so spakati ya tila hot la hit na bakati cha that no hot la not so spakati ya sinan ada no sinido kwasin da no sini ako ala tila kotole naso ne na koto ashi tishi nas ni shi sa hot shi la ta kodonato sto ko ela kodola be hadati la be ni ya sto dati no anda sit ko dila na so sla ba khati ya ko ba hensen slan tado na sinido hasu so aden hada no anigi ko o hen hedish ni a question.
So, actually, what Edo is, Hela so Hananazi. Ado, AC Kido Aya committee, but DC.
Michelle Khan, John, are you there?
Okay, if there's nobody else gonna do the presentation, committee members, we had forwarded the original request. I had sent it out to the committee members last week.
Accept the report, Monica. Second Delegate,
Sheila, committee members, we have the report. Otto, real quickly, Mr. Begay, Otto, that's Dr. David John. What through the budget request?
Manley Begay? Maybe you could say that about the budget. Mr. Danielson?
Oh, yes.
Could you repeat what you said? There's some voices I keep hearing, and
Sheila, the main thing is to report that based on the indicators without need, yeah. Of course, it does. Kate Archudo, Itigi, Hatubeha, or the Akonde, a nail, Egi, a nail, na a paper, the Noki, a digi, so let's make it part of the record. And so, yeah, and yeah, that's next.
Oh, Yananat Alkahasing Toshan and the Tano Saniki, T-shirt David Johns, a Corona Ehos all this me. Over 4 years ago, the Nat Hockey Association, President Billy need to call. A coco, a kunza to hold this call. Need a ya to quit the Shiban seat. It within a little bit over 3 weeks. What by Yale Kidoba Nate fish behane. A coco, jo a hot out a ya a the quigo she hot on the Bikia the lean. The Nat Hockey Association has two sani ben hat ai lale slatin doba anache ita kwa hashin hol jese da hot out yat and has even na hot out bikhala ben hagan liniki to a large adon da inna ben aligit out to a Eda schot yagitissen go. Shibin that hot he kon the household just not other this kid. A job of Yanan hit me. A coco Nihas Sinda Ben and of kin. Ben Hagabi, the higit, when the Yinda who is 2000 the quid she what out even Hagan Lenigi Nagan Lenibi a coco the deed adult let the cossin Lenigi need Hahon the Latios and the league behold that the Lee adult how you did the never that is not those I can the has cut. So even that long person the need to it. I don't that a quake could all have yen those nishigate in that chido instigate the quid she to Evan Yasil kids the lake home. A coco the more do you hold the shed down to a facility. Now, not the more the head down. So it so the nasty do to that because that 17 and nasty ain't high to that quay. Beson Liniki close to $800,000. A quay beat it, not long. What are Hachichinit, Asli, Adon Nebikiana, Nana, quite Eshihit, a quashihit, adult opi Khan Hadlo. A coconle 1 million with the El Chit Coho. What's that? They what are not so suppose they'll give a car Ilia Coho. What out a ya has the Ada the just kid a quake.
Hi, David. This is Michelle. I'm on the call, too, just letting you all know. Michelle Kanjan, DHA Secretary. Yes, thank you.
So, you see, also say the lagging, you have the tenant I, that's we, Mr. Dr. David John, okay, Michelle, I just want to, the aspects of your proposal, Dr. Mando DeGay did an overview, and I'd like to just make part of the record the request, the budgetary amounts that you're requesting. You don't have to review line item by line item, but the dollar amounts that you're requesting, the council for the getting access to part of the CARES Act funding.
Right.
Okay. Committee members, that proposal needs in England, we already have a motion and a second to accept the report, but I really feel like the budgetary amounts need to be made part of the record. Even yet,
Chair, Delga Wanika.
Honorable Edison Wanika.
Thank you, Chair and members of the committee. I appreciate the presentation. That Oyo close to $1 million. Dida is 7 years. COVID-19. Dina Snige, Bikija. Now, Nishigi, Pahato, Lishigi, Hitao, Bened Listo, Lispetado, Kahat, other deal. A co-pay, Bansis case, or the almost $1 million. Nenige, the tea without Dina Snige, better now. The age of a car, yedo late without the Nigahat. Ado ihat out of a trotnet there. John in the ilo, yelit ilo, even Nashe, Hashin Sobaka, yet. That deal almost $1 million and engage Ashit or Obaka, ye dolly. A quagget or you said this. Ado Hashina, not or little store. I died question it and hat can hit na. Although the question on it or little it about Sunda. Joy the banda econ, but yet to the diesel. Do it on nature, do it without Zawnage and with Nago that it no. Joy even yet so the Zenigin done here. A course a card or Western zone. Shadon I can load it by leaders or Chon Shettle Law Evans's case. When in addition, it's because of a medicine man, 2 medicine men that I'm here today. And there is no way that I can deny the powers that they have. Akonde Shijaya without Shatkashdalaho Hatati. Quay a genie at Arco. Shadow Chon all ye that okay with Arabic, the heart of the a Coshatoid Aqua, which now there has to be a sacrifice on your part. A Quay Bansis Queso. Toyo cities, Adi Base okay, Digi Hajopa Hosano Liao, she had 8 or less. Dona can loy as she be cases of the Annie, Adenature, and now Wogi. A quite a chair, or you would ask this Anna Bansis case, quite a bit at this. Yeah.
Oh, Sheila should tell it to that. Oh, he in not so not fully out. She thought that. If you have nature, have you seen so out of the case slowly? Of course, a quite cut. Joe Bells and So, John Elia, so Jundo Lake Craggy.
Chair.
Honorable Paul Begay.
Thank you. Yes, Chair. Do yat benesto. Ado ade nature presented in Lagi from the Navajo Nation Hatkasi Association. Should I see it on bad and she had Hati and Lonshia and Saina. The year she clearly so she had Hati in Linde. Aros Nala Sunali, you see she was Nala has been taught Hati in Linde. Kodia. So what Kitty J. National Hatnan, the Translink, see a quite cheeto in Spiniaco. A co hadne la yadi had trato na harapa alne to 8 or 500. Ado the best of what Kitty Sata Sohoki ADG ito ato Nitisha ne the Hatida had a latrito is 8 see not ego what our Bahasan even not a bad side kiss the does on it all this. This or what he did or build out of the city to itemize Alia, but had taken the 80 pesos of Chitado. 80 gito don't shut me dato, non in datos of source, the door not in Chitado, a quacket of Bahasan, a call, a quacket I thought overnight kit a little. Ya Hashine La Pacato, what she did to the idol of Bahadan. They had Haslin, then he Heshi Pana Hato Gatli, Heshi Vicar, Hikin Hato Gatli, ya up the Pansla. Hashine La Bege, the door, Nito had Ishi Bege, the door, to Yapakin Havaki, a Pansla. Heshi Shahito Ashin Rede, Traslin. Hatrasi Yinsi, Tree Azik, just Nito, Aso Yatinal Yellow or Nessie, a Pansula. A call the base of what Kiriti, a does Archer, a store a year, and Nagi does Archer Shinte, Joe Quaggy, a Quaggy, or Space, a dash. To get it or Nessie, Navikin out of Carty, a sea Mansula. To aid in a yarn distributions go a quite hot ko Arab and Nagi, a yarn, sufficient material as a supply that Hatila a quite aside of the meal sagi cho isla. Once on your bansas case a call. Even in addition, you quite not so many that so that's what the quite a bit of cheeto. But car what out has no for the bahu in the area about this thing, should say, other present or Shagi.
This is Lorenzo Max, Honorable So. These are this, the donated dish, kisses. The question, proposal, I'm wondering if the council delegate are this, and they budget, it's other sort of a khaki. It does this, they that's it. Although did it, put that kid up behind Ziggy, I didn't catch your name. Of course. So a quite asked easily a Jordish Arsenson. So this cheat you the ne, the chain the witna. Oh, you don't none the share. That's a husky. Just like that, it's interrupt with that. Don't that in the short or when the house. Although, even before the pandemic, I thought in the head done that, you need the net on that in the store. That's why you are at a book on the hello. Oh, the kino, if in that eight, a cocoa, look at it, it's even worse now. Chocolate Annie, J. Aqua, she, a joke. It is she, dot is it a hat or also خارتين دخاتو جشوت تنغيدا يهوت جشينه أكو أنتي تاهوت كو دينيزن أكو شتي خاتخالي نيجي شتو ألسكو هيل ده an lede nastet passa ongal hashine la sendo so de nastet che dige che ton hini higin da ton hini so de zend dige ne etape ni na yope is to ke da joha ne ko choko ya hota naste nilia ako hopo hol at ne apo hol ni happy eta han sindo technic ego to na hot igi pikako ta hot ego ya da jeseko khale khali chilini akha hasti chot in the khado shi ya o hayu hat khali asa cho na hashlata ni ko cho hananas ni cho to jo o agi hollo Jada ni isi hot ego you ye that okay ya nakri. Joko I don't know. Although some of them are not even traditional ceremonies like Odal ya. So that it gives us a bad image of ni members in lineage screen the deal net joy and needy nahagapasa on gala 8 to hanne pata hollo to hot ego be den sort aronda be hatastena on nil be do yel dal do so hot apanil anigit ego ba huilia without no external funding joko jorat ego by del tido bansasi case adon da ya diganan date to interrupt dal ya to o nail sit na halen to hot ya huilne echna initle ko kje do ta to ba do ta le ki yak at to ne he do ta hot al khan no khalen to ba hat sit na halen ko just a few days ago out COVID-19 betolna just came long Joko ebo mai hota hitu chago trajda the picture trajda ti ako picture de shatland do benastic no hot ego in jaza ko kunia be na shla kaneshna hot chwa da ko pat sta hot be na shla so the zenda khata shla kinne ni he the taste buds and that is slido gade yat no pa ne ko si ye na ben and jo that I otanel analot out so how do be the Indian Health Services in do you ban method for see go nel in the law you begin as la ko hodat ko do ako bikanji lego je hota ko ihe ya your kale dosa na khan na ta then it seems that we're just completely left out obe deal wasigi je dan hi holon ta hanne hashinella aton da jot an bisni hilni ba huilia aron da ti de atishin nasni to betesni da no obe ke ni je Because is it but a hollow but the tosni we hollow and later what bata hachil to be that a hollow so ADG we need that awareness so I don't all what but so I don't know if you guys have the budget in front of you so if you do if not, we can probably go down the line and either myself or Michelle can go down the line and discuss each one of those items.
Sheila,
Chair.
Committee members, last Friday I sent it out. to you folks, as well as Honorable Vince James and Honorable Nathaniel Brown. But then I sent it just about 3 minutes ago. But I guess the main part, tonight, Mr. Lorenzo Max, Quacky, individual patient, either ido listo, aya sakari das ito bol ko ato Quacky hokas leki cho ido leki a Quacky in that is kidi Quacky a kajo a Senate league committee members. The way I understood it was part of the program would be in the area of the mental, the physical, the spiritual, the behavioral services that they would offer as part of this program. The other is the fact that there would be a curriculum developed that could be used in the future. So,
Man, the gay,
without the committee members. Mr. Max.
Chair.
Go ahead.
Thank you, Chair. I'm sorry I didn't introduce myself. That would be Paul McGee. And the kid right after Delegate Edison Wanika. Today, the Bishop Gado could be talked on a link. The Chido, Sanabasabakin, Bishop Ananshla. Makoegi in Mr. Max, she Ehonson Archibald. And the way such is that Anaholi, Ado Easy Nasha. Ado Shia Hatin, Linded Oceanalado Asian Shiahan, Santa Shingi, Ado Shia Paul the Gate, Ahot Ego, Ashi Ado China, the Georgia, Ado Shanala has King Bachin, Ado Bahajon Nibiki, Addition Asian Shia, the horse Addishingi.
Hakwashidi Lorenzo Max Nadet. Oh, she don't Asia ho. To see some honorable question is Tagat so much or Liene should say with the snow. A hot national George at Carter, Ado, the lad is Cindy Lachin and snow. Ados keep it kine and Albogan. Ado hini yazi that Jolieto look on Nez Ram herder a national khan. Ado Ada street Nagayeta he kante. Ado strat sort of a noto, Ado Charles tweet and Lido Shija. What our bells then go a nasty haggage a Parkinson. I call a what our Bahashia, Ashidebich. There's nobody else then. It's out of date and it was Nagata. I'm the last one. So what ego what our has uncle. I call a Nagage, you in Schnido, Shimado Shijacopanses case. I call a what ego Nashledo Bahashia. I call Ashi and me so did means that Casey Yego. Everybody talks about Dida Halit not a dot physical treatment we got the dot later. The mental anguish not the door a Yahol neto means that Casey your Yego. Means at all emotional stress that a mental stress. Ado city kosangi egon sea case. The ko ado the eskinel the ko. Jo kwagi edo ya yastida. The ko in that case each no jo and a lot of the yego. Bendal nishu tata it skis. The tata it sida. What an so it's really worse go there. So that ego that ado curriculum gido communication ado and we need to hire consultants too. Ni ka adol wasiki akot asa ni silket and losa ni ka andal when the whole regular jobs akot they can only do so much akot. Asi yego jot alle na khai kek ada to ligi to petanitle khalan anhis na hon atida khalin ditlene so atida proposal da hol yagi dilne kibichen na hon la jot from the government da are peso iti kilikin do pahonils and so we need help. I don't that based on that the next that maybe it can be leveraged. Matching fund needs in here that then on fit that the whole so that maybe those are some possibilities. Adult education Navajo was Nahan, Hajin Nade and Netoida, Ede Yatacho, Chokwa, these Shedin Hilehot, Ege, with he Zihikito, open net need, that open net needs Joko. Eko Jorat, Agi the Yachoi, why is the natural universe, Nasan, Himayat is where do we belong? How do we fit in? So that ego that in that case between immune system between so that I be honey the basis so that ego so we need help to put those into pamphlets and publication so for social media what ego GD in the John Kisbahas and the Shilhunsta. I'll chin and Linish Yoda Yichin, the Joy, a Jordani, a Yahdo, Nildo, of Spanata Hutzinda. So there's all these costs, Although we need to get a director, a coordinator, auto assistants, and Lingita, advisors, and Lingita in here that then, so. We need funding to get those, get it on the fast track, so they can help us, spend this money correctly. Auto and the financial personnel, then Lingi that and he hold on that audit that preparation for audits that and Lingi that base of and then that the traveling and stuff like that. Aro hat khatin lingit o yu cho inal to okay won la beda yis kha no ba ta na ko joko hot we're just like everybody else nail the shehunst ko up nas the hot an he jo pa bi to jo te go ha te go shi na hui claro so the na nail nese Jokot Anhas, he Jot Ebony Nago, Yago Bay, we need to supplement those, so it can be worth their time, their travel, to go where they need to go. Jot other Flopan Sea case, I don't know, maybe Michelle might want to add some more things to this too. Okay, Sheikh Ahun Sohot yeah, and that was Kitty. Abanil anigu corona bana huilne Michelle or Mandy?
This is Manly Brigade back on the call. I apologize for having to leave the call. I had another call to attend to. Paul.
Hey, just a minute. Pernell, we can hear you talking in the background. Go ahead, Mr. McGee.
Okay. I say my discussion ado touchy but she look at net that she do totally national they put us other you see na shadow tunnels the other so neya so other east so for but net that she just kid and not I always say I'm from both places, Tuba City and Wheatfields. Corn they told us the baby kid na shan there the trade that other Doshamasana air lunch card as Kita and Shahada or the tashi up at the Hanos in there, that I should cheat the Virginian there, though a nut load at the yen there, though Cheshire beat at the yen there, though Dagash still did that yen there, not show ship yet the Virginian there. You see, not shut with us are there, called there. Tuba City, they are the each door are the door and the yard. So, what are able to say that on this? The way we put down a label garlic, Bayati has your basic article. In the addition, one of the main reasons we're putting this together is we're really concerned about our people and their mental and spiritual state. And as a result, particular ceremonies were conducted to find out what COVID-19 is, what this coronavirus is. It has several different names. And from a Hakati perspective, there's also another name. So that needed to be identified, and I'm not sure if my Nana Lorenzo told you about this. So these diagnoses have been done, and it really needs a tremendous amount of education around prevention and the protection from the virus. And from a Hakati perspective, they felt as though that yes.
In your original presentation, the committee's with you in step. Get that the Kanya. Oh, Quacky. Beso de no kidigi. You see, Quaggy, how are you expecting a prospective patient to have had the aspect of Yale Lahiki, that's going to interface with this funding request? So what's I see. Quaggy. You see that like I said, okay. The committee is in lockstep with you.
Okay, great.
With this discussion. So,
okay. It's probably more important for them to answer that question. So maybe Another Lorenzo might answer that question. She do hakatin slida. Or the yeligi a bit of a dead. Shananda Shana David Johns had about the
Right. And this is
Lorenzo
Michelle too.
here.
I can write a rough breakdown as well. So let me know when you want me to speak. Thank you.
Okay. Good to hear, Shanala. Ako sa yelidal ito pinya zedal. Chorat ego pinya nata. There's a lot of things that goes into it. Got I see Jordan never catch in Gator. So this change because of the interruption in jobs. So it's in that all happen. So how I thought the never that there was already high unemployment. Of course, I don't know Janet So that then we had to take extra precaution, sanitizers, and that's so that I because so it's just kind of like supplement. Patients are letting it all little. So it ain't the corona haligi we want to make sure they're safe. We want to make sure they're well compensated for what we're asking them to do. So the point is in data. Out of the COVID-19, Mr. Begay tweet that chin is social nasta hasn't APG Holoniki a concussion na yet the nepen a mash will in a yin of snish will in a yin of snish by niziti, which is to it any by niziti, netniki old a by niziti, Jota APG. Ida hot ego a daily jigo that we have your scale. A call Yagi, your scale store at arch in that dot lay. Jot are that we have to call. Say, Nesne, what was what in that be. I got all Yajigo, which is lot Hatino has transcend has the So ego is that all you have never hullo. So I see training now. Navajo need plenty hajiki sat anas instead. Because now you have a common name too. So got did nas ni holyagi to edo busy hollow. So got busy FAC na. But I see kodo a baby jigo a baby cow to dot lesita. The quarter hundred long at echo. The quarter ayatan chitne has tweet. So what any quay what I in kitchen are only.
Honorable So, this is Michelle. Would you like me to go through the breakdown for the funding request?
Operator error here. How do I say? Yes, it's on mute, but let's very briefly. Let's
very briefly.
Yes, just the budget amount.
Okay, I'm going to go through really briefly. So I'm Michelle Kanjan, the secretary for the Denahakasi Association. I'm from Fort Defiance, but I think that's just changed. And so very broadly, we have four main objectives. The biggest amount of money is going to an objective labeled ceremonies. 5 regional funding. Regional funding. Our Hatkasi membership has a membership of Hatasis, approximately 200 plus certified members of our Hatasi organization across the Navajo Nation, and they're broken down by the different 5 regions on the nation. The biggest chunk of our money, close to $400,000 of the funding request, is dedicated to supporting them and the communities in these 5 regions with relief support, because they receive their income through the ceremonies that they perform and provide to the Navajo Nation, to their patients. And so the largest portion of the funding goes to them to help provide some relief support and also to help meet the needs of those communities, whether that be with offering ceremonies to those community members in those regional agencies. So that's one section of that's objective number 1. And then the next objective is we'd like to offer actual ceremonies. As an organization, we have Hatasis that have been offering and delivering ceremonies, as already mentioned by Mr. Max. These ceremonies have always occurred seasonally. We've always been doing them, but we've really done a few more protection ceremonies and offerings since the COVID-19 has come to the Navajo Nation. So since February, March, April, we've been doing some consistent ceremonies and this is basically a volunteer effort. There's no donations amongst our membership. So that portion, we're asking for about $160,000 there to continue to support the organization so that we can pay our Hatasis to continue to shield the Navajo Nation with these seasonal ceremonies in all the various specialties, including protection, restoration of harmony, prevention, diagnosis, and this is on a broader picture for the entire Navajo Nation. So that's the second objective. So around $60,000 there. The third category is we'd like to educate the people of the Navajo Nation about some of the traditional teachings to help strengthen them, to help make them spiritually strong, mentally strong, to help them cope with the grief and the loss and the fear and the mental anguish. And that requires some funding to develop maybe written material, radio announcements, newspaper articles, social media, and we need to develop and package this curriculum to help our people be strong, empower the people. That amount is roughly $60,000. That's our third objective. Then the last remaining amount is to support all of the equipment and the special consultants that are going to help us achieve this, because with the CARES Act funding, we understand that we have to meet Treasury guideline requirements, and it has to all be related to COVID relief. And we also know that there's a short expenditure period. So in order to do this and carry out the objectives that we have outlined in our proposal, and if you go to our proposal, you will see everything outlined as we propose to deliver it. And we can clarify that in the future if needed, but that's basically the breakdown. The remaining costs are reserved for the consultants and any special people that we may need to help us achieve and deliver these objectives. So I hope that helps clarify that the request for this amount. It may seem like a lot, but there are like I said, there's 5 regions, and there are many people out there calling on the Hatasis for their help. But many of them don't have the resources to have a ceremony or to pay the Hatasis, and so we'd like to be able to support our regional communities in that way, and also support our Hatasis with the relief funding for the losses that they had because they've been on social isolation and restrictions since March. Thank you.
With the ALA committee members, do you have any further questions?
Shania, I have a question, or a couple questions.
Satilla, Honorable Slater.
Thank you. I know that we discussed primarily the funding request. I don't know if now or if we're going to end the presentation now or if we're going to continue later to talk about the idea that you've expressed and I think discussed with the association regarding a 4th branch of government. And if that's something that's worth discussing now, or we should table that discussion for another day. I know there's kind of time constraints potentially with a 2 p.m. work session. And we have a lot of other reports and legislation to work on. that's one of them. And then I wanted to express to the association that still very supportive of the effort in Mukachukai to get some land. And I spoke with a member of the Club C, and I'm hoping we can get a Zoom call or something like that done either toward the end of this week or at the beginning of next week. But I'm sure, just as you're very busy, I am as well, and I apologize for not having followed up with you again. But I know that you've been in discussion with some folks over at the Club C. So thank you.
Thank you, Honorable Slater.
Yes, committee members, part of the discussions that we've had is Section 1 of the Navajo Nation Code, the fundamental law. In there, it talks about a fourth branch where the traditional and ceremonial leaders would basically compose the fourth branch of the Navajo Nation government. It's already codified. That is how it's going to be. But the aspects of the authorities and responsibilities isn't very well delineated. And that's where the Honorable Slater is talking about that. I really feel like that's the next step in growing the mother government. As Honorable Amber Crotty refers to our Navajo Nation government. So that is the aspect. And for the sake of time, we'll take that item on in a work session, or as Resource and Development Committee has established and NAVI is starting to take on called a leadership meeting. So that would be scheduled in the future. And when we come up with an opening in our schedule, we'll do that particular discussion. With AILA, so committee members, if there's no further discussion, I know I sent the second copy of the proposal and the budget. I guess for the record, please acknowledge that you received it.
Chair So, I'd like to make a quick comment.
Priscilla, Honorable Wanika, Honorable Halona, I know you're in the same room.
Yes, so listen, thank you for giving us the report and what your goals are. I understand and I see. It is important, but at this time with this pandemic happening, I don't know that you got the executive order or the order out of the Speaker's office, and that was sent out, I think, in March, where was asking for all religious ceremonies to be postponed until a later date, until after this pandemic is subsides. So because we don't want to. The way the traditions are is we get together. People are invited to the home for the ceremony. There's a lot of eating. There's a lot of sharing, and it just creates hazard for people to catch the virus. And so I know there was the executive order or the order out of the Speaker's office that was sent out to all the medicine men, asking them to not partake in any ceremonies at this time. So I'm a little bewildered on that because that you were saying you're having ceremony. But this project that you're talking about, it's a good project. It's a long-term project. And I think if we do this, we need to do legislation to put you guys into some sort of a program which is recognized and do budget report, budget analysis. And because spending this $1 million, the deadline is December 30th. And with your program, the way it's spelled out, it's a long-term program which will be continued long into the future. And so that funding for the CARES Act won't be able to cover it after the 30th. And so those are just a few things I wanted to talk about and let you know that, we should be doing it a different way if you want to get extended funding for the program in which you're seeking. So that's just my thoughts there. I appreciate it. Thank you for listening.
This is Michelle. Can I respond briefly to that? Thank you for the comment.
Let me basically provide some guidance. Honorable Halona, if we approve this expenditure request by 12/30/2020, that's what the CARES Act calls for. It doesn't mean that it has to be spent. It can program the recovery, the remediation can go beyond 12/20. That's the way I understand the guidelines that was basically reviewed by DOJ and our legislative council. So that's the clarification I wanted to provide. And we need to be, I guess, understand that so that the requesters can also have that full understanding also. Ayla, committee members, because let's just face it. Even in the gone away of behavioral health counseling, you can't put a timeline on it. It depends on the individual you're providing services to. So even within the $50 million that are supposedly in 116, that's going to go beyond 12/30/20. So let's, I guess, go for it with that understanding. Committee members, any further question? If not, then we'll, the process will be that we will forward this request as part of the CARES funding request to be included in what the speaker has packaged in the different categories. Since they have not, since the Denehakati Association has not been officially recognized, so they would go in the category of non-governmental organization at this point in time. That's where their funding request will be categorized. With ALA committee members, with that vote, are you ready to vote?
Slater's
There's
ready.
no question. Okay. If there's no further questions, then the chair will call for the vote. Roll call.
Honorable Paul Begay Jr. Green. Honorable Carl Russell Slater.
Green.
Honorable Bernal Halona.
Red.
Honorable Shirley Stowe.
Green.
Honorable Edison J. Winika. Green. Jerry, a vote of 4 in favor, 1 opposed.
Okay. Committee members, let and the public know that the vote is 4 in favor, 1 opposed. The chair not voting. Otto, Shastri, Zazani, Dr. David John, Lorenzo Max, and Michelle John, and Natalie Gay. Thank you for the presentation.
Thank you, Mr. Schultz.
Thank you, Chair.
Council Delegate.
Thank you all.
Okay, thank you. So we'll go up to item number 5B. And we have Mr. Carlisle Begay on the line.
Yes, good afternoon, Mr. Chairman. I'm back on the line.
Okay, great. So go ahead and proceed with the report on the medical air transport.
Okay, thank you. Good afternoon, Mr. Chairman and honorable members of the Health, Education, and Human Services Committee. Yet Ashe Carlisle Begay Nashe Twaskwani Slaki Ani A Bashichin Ado A Tazanda Do Dashinella. I serve as a federal and state government affairs advisor to the Office of the Speaker and the 24th Navajo Nation Council. Before I give my report, I will just take a moment to acknowledge that we are living in unprecedented and very difficult times here in the Navajo Nation. The coronavirus has no doubt taken an immense health and economic toll on all of our families, our chapters, and our communities. And I just want to extend my thoughts and prayers to each of you and your loved ones during this difficult and challenging period for our Navajo Nation. For the purpose of the report, just a little background, Mr. Chairman. This past Friday, I was contacted by Congressman John Curtis of Utah on behalf of Classic Air Medical in their multiple attempts to contact Navajo Nation regarding an immediate concern of their ongoing support of air emergency transport services across the Four Corners region of the Navajo Nation. Their concern really is a result of the millions of dollars in their view in losses on a normal year of service, compounded by the increase of the IHS and Tribal 638 flights that they've taken to transport COVID-19 patients to various facilities here in the Southwest. I believe my conversation with them last week, they had indicated that in the last month alone, they have transported over 90 positive COVID-19 patients from our Navajo area IHS and Tribal 638 facilities. Classic Air Medical also acquired 3 isopods, which was purchased on their behalf to safely transport COVID-19 patients in a fixed-wing aircraft.
Thompson.
The isopods are a negative pressure individual patient isolation unit that keeps the contamination or their positive test of COVID-19 safely within the unit itself. Currently, Classic Air Medical does provide emergency on-scene response as well as inter-facility flights from Chinle, Kayenta, Navajo Mountain, Landing, Page Hospital, Tuba City Regional Healthcare Corporation, Inscription House, and many more of our facilities on the Navajo Nation. They've operated, from what I've researched, they've been in business for over 30 years and currently provide air medical transport in the states of Arizona, Utah, Colorado, Idaho, New Mexico, and Wyoming. They're based in North Salt Lake City, Utah. So just a little bit of background, Mr. Chairman and members of the committee. Their perspective is largely from the ongoing low reimbursement that they receive from specifically IHS and tribal and 638 facilities based on the current framework of Medicaid reimbursement. They've been one of the last remaining air ambulance providers in the region. In my conversations with them, they will have no choice but to shut down their operations on the Navajo Nation unless there's a short-term solution that perhaps gets them through this pandemic, as they've had, as I mentioned, an incredible surge in air transport services in the last few months. Prior to the pandemic, they've indicated that they've had multiple meetings and conversations at the IHS federal level and even at the state level, including meetings with the IHS director, Rear Admiral Michael Leaki, meeting with him multiple times on this issue. They've also tried to engage in the Interior Appropriations process with not much resolution. But Wade Patton, who is the Chief Operating Officer, and Alexander Tarbett, who is the Government Relations staff member for their company, are on the line and can verify any of the information that I'm telling you here this afternoon and answer any additional questions from committee members as well. From their perspective, again, a lot of this has stemmed from the fact that IHS is limited in what they can reimburse based on Medicare-like reimbursements. The Utah Medicaid base rate for air ambulance is $202.18. From what I could tell, the base rate for Arizona is $295, but again, they can probably verify that in more detail. They also have strict guidelines in terms of what is covered and how that's covered in terms of both IHS and Medicaid from each respective state of Arizona, New Mexico, and Utah. There's a specific framework that covers their services. But the purpose of this report, Mr. Chairman and committee members, is they're seeking an opportunity to one-on-one continue to serve our Navajo communities and Navajo facilities, but just can't seem to do so based on the current limits of the reimbursement frameworks. In a typical calendar year, they indicated that they were able to continue providing services to the Navajo Nation largely because the private pay insurees were able to offset what low reimbursements they were getting from Medicaid and IHS facilities. I'm not sure if Rosalind So is on the phone from the Navajo area IHS, but maybe she could give some additional background. But with that, Mr. Chairman and committee members, that's the background of the intent of the report. And again, both Mr. Wade Patton and Alexander Tarbett are on the line as well, listening in and could perhaps answer some additional questions. Go ahead, Mr. Chairman.
Okay, thank you. And committee members, Mr. Begay had forwarded an email to us respective of the issue that's now on the table before the committee. Do you have any questions for Mr. Begay? before I turn it to the two gentlemen from Classic Air Medical Transport. Okay, if there's no questions, then Mr. Begay, can you introduce the first presenter?
Thank you, Mr. Chairman. I don't know if they weren't prepared to make any formal presentations, but they're on the line to answer any questions. But Alex, if you want to go ahead and introduce yourself and just give any additional context, perhaps that I might have missed in my presentation.
Absolutely. Good morning, Honorable Chairperson and members of the committee. We're very grateful to be able to present to you guys today regarding an absolutely critical issue. And Carlisle has done a tremendous job framing the issue. And there are just a few points that I want to hit, and in the interest of time, we'll wrap it up as soon as possible. But full disclosure, under a normal year, Classic Air Medical loses roughly $3 million flying IHS patients just because of the chronically low reimbursement rate. And we want to recognize that it isn't solely IHS's fault. It is absolutely just a cross-jurisdictional issue between the state, between IHS, and the federal dollars that are coming in. We've worked for the last 3 years to address this issue, both at the federal and state level, and haven't been successful. But once again, I do want to reiterate that we suffer those losses, not only because we're one of the last remaining providers there, and if we were to leave, the effects would be catastrophic, but under normal circumstances, private payers, privately insured individuals do offset those losses, and so it allows us to continue operating there. During the COVID pandemic, we have seen a tenfold increase in the amount of patients that we have transported on the Navajo Nation, and we've actually shifted to 100% IHS flights. We've had to move in additional airframes and crews to staff those airframes, and then we've had to go to the astronomical expense of negative air pressure pods, as well as PPE associated with transporting COVID patients, and then the associated risk to our crews. So we legitimately, over the last 3 months, have done our very best. And we've cast a very wide net, both with congressional offices, with state gubernatorial offices, and then locally with IHS, and now with the Navajo Nation. But our intent was last week to leave this Friday, simply because we cannot sustain the economic losses. It was very well put that over the last month, we've transported over 100 IHS patients who have tested positively for COVID. That's not just transporting patients who we have to make room at facilities or otherwise, but that is positive COVID patients. We are the very first people in line to help the Navajo Nation. We have been there for 30 years. And so we ask that you sincerely look at making an individualized contract with the air ambulance providers in the region so that we can cover costs simply until December. The contract in nature would need to be retroactive to cover the losses that we've sustained. But if something were to not change at this rate, we would have to leave within a week's time. And subsequently, those patients who would otherwise be transported via rotor or fixed wing would not be transported. Once again, we love serving this community. It is our last desire to leave the Four Corners region, particularly at this time. But economically, we just cannot continue to lose tens of thousands of dollars on each flight and be compensated $300 or $400 for a flight that costs $15,000 or $20,000 now. Wade, do you have any points that you'd like to make to the committee?
Well, thank you, Honorable Chairperson. So my name is Wade Patton. I'm the Chief Administrative Officer, and I've actually been a flight nurse in the region for 20 years. Obviously, I'm in an administrative role now, but I have transported from that region thousands of patients from the Navajo Nation. And it's very, very dear. That location, that area is very, very dear to my heart. The people are very dear to my heart. But I think it was said well in that at some point there has to be a tipping point or a breaking point. We can't continue to provide what really is and we're not overestimating this. I want to be clear that it does take approximately $10,000 at minimum to transport the normal patient. That's not a COVID patient.
Yeah.
Since the COVID outbreak, we've had to increase our staffing. We've had to increase PPE levels. We have to decon the aircraft every single time the patient is transported. So our overall expenses have increased 400% since COVID. And like most of them have said, we've transported 100 patients so far that we know are positive. That's not including the ones that maybe haven't been tested. In addition to that, we're still transporting 3 to 4 Navajo area patients from all of these locations every single day. So on average, we're transporting 4 or 5 patients from the Navajo Nation area. Of those, usually there's 1 or 2 of them that are COVID patients per day. And it's just become a point where we just, and it breaks our heart. I wrote a letter to be put in an email that this is the last thing we want to do, but we just cannot foresee continuing with the losses of $10,000 to $15,000 every time we lift to go take a patient. And so we need some assistance, some help in this. And again, we would love to continue transporting these patients and taking care of the communities, especially in this very, very difficult time. It's just we're kind of forced. Our hand has been forced at this moment. Thank you.
Committee members, any questions? If I could have a motion and a second to accept the report.
Motion, Monica. Second, Gage.
Okay, thank you. Honorable members, motion by Honorable Wanika and second by Honorable Paul Begay to accept the report. Any questions to the presenters?
Yeah, I got a question. Chair,
hello now.
So the question I have is right now for the money that you guys are still seeking, I see, is it $4 to $5 million range? It's what your immediate costs are, and then if we get legislation started or get you on the list to get paid, what are you guys getting paid from IHS? How much are they on the ticket for these costs?
So I can address that. Once again, thank you, honorable committee member. This is Alexander Tarbit. So the issue at hand here is that we are being compensated based off of an administrative rule change which made IHS the payer of last resort, effectively sending the rate over to the respective state Medicaid rates. So what we're being compensated right now is based on Utah and Arizona Medicaid rates. So in Utah, for example, that base rate is $202.18. And so for a total flight, we will, depending on mileage, we can range anywhere from $400 to $700 for a flight that's costing us $20,000. The monies that we're seeking, and once again, this is a short-term fix for a significant issue, is that we are seeking a short-term contract just for the duration of the pandemic, of the outbreak. It would be a per-flight flat rate that wouldn't necessarily make us money, but it would be enough to cover the losses that we have sustained. Once again, the contract would need to be retroactive for the 100+ flights that we have flown since the outbreak. But yes, it's right in that $5 million range. And to be quite candid with you, the compensation that we would receive would still be less than what half of the market is paying us. And so you're very fortunate in and of Classic Air Medical is altruistic in this circumstance where they're still willing to lose money to stay in that region so long as they're offerable.
So, Mr. Tarbit, do you have a contract in place?
We do not, sir.
but you made the statement, contract retroactive.
The proposed contract. We still don't know what the solution would look like at this time, sir. One proposed solution is that we could just get a short-term contract for the duration of COVID, which would cover just a fixed fee per flight. Once again, we would still lose money on that fixed fee, but it would allow us to continue operating and cover some of the losses. It's just that at the current compensation rate at which we receive from the state Medicaid base rate, it's roughly $700 for a $10,000 flight or a $15,000 flight.
Committee members, any further questions?
Mr. So, Daniel So, Chair So, this is Purnell. I was wondering,
Go ahead, Honorable Halona. Go ahead.
What can we get from IHS to help pay for some of that? I mean, are we going to just go ahead and try to get them Are we just going to go ahead and try to get them on the list to pay this off with the CARES Fund money, or what are we looking at?
Well, see, that's up for discussion, Mr. Halona, Honorable Halona. The issue that Carlisle Brigade basically brought to us is this entity is losing money. There was no request for reimbursement, no request for monies to supplant their operation. It's a report. And, you know, some of the figures that they divulge, for myself, we got to see it in writing for us to react, and to just take a verbal statement during a committee meeting, report. What is the usual record that the committee has? It's like, we need it in writing. So that would be my response to you, Honorable Halona.
Okay, so that was what I was leading up to, is we need something in writing and a good number, a good figure. But the other thing would be to continue. What is the outlook for projection on how much we might have to be coming up with in the next month or 2 months? Because, we really don't have an idea or have a clue on how long this COVID pandemic is going to last.
Understood. Committee members, Honorable Slater, can you take over? I've got to take a call with Speaker.
10-4. To the presenters, I have one question right now, and that is, what is the path forward that you're seeking? Are you seeking Navajo Nation support for some sort of legislative fix congressionally? Are you seeking funding from the nation? I think that's, just to be candid, that's probably going to be an uphill battle, given the needs and the budgets that have been put forth and the responsibility of IHS to pay for these services. It doesn't sound like there's any legal action that you proposed, but is that something that might need to be considered with the force of the nation if we're going to lose access to healthcare that should be provided to us because IHS can't integrate it into the payment system appropriately? I mean, whether it's the area's discretion or problem, we know they're working hard for us. That's not what I'm getting at. But if there's rules or things that are preventing them from doing what they know may need to be done, if you can try to elaborate a path forward so we can deconstruct it in our questions and responses. Thank you.
Absolutely. And once again, thank you, committee members. the short-term fix that we would like to engage in is just a short-term contract, which would allow us to engage directly with the Navajo Nation simply for the air ambulatory flights. The long-term fix, we would love the nation's support in addressing this, both in Utah and Arizona, possibly changing those base rates. But right now, for a short-term fix, we would have to enter into a direct short-term contract with the Navajo Nation to receive some sort of ancillary funds to pay for the losses that we incur flying those IHS flights and subsequently the massive influx of IHS flights due to COVID-19. Once again, we just need to be very candid in and of, we're losing millions and millions of dollars each year, and that's exacerbated during the current pandemic. And we're just looking for a short-term fix from now until December. As far as an emergency medical service, we de facto are the lifeline in the Four Corners region, and to lose a provider there that has flown over 100 of your COVID patients would have catastrophic effects. And so we are looking for a direct short-term contract with the Navajo Nation just to cover our losses so that we can get through the pandemic and continue providing services. Otherwise, we would have to cease services at a very soon date.
Okay. So the idea would be to contract with the nation, and then the nation would be reimbursed, and that would also supplement to make you whole or closer to whole of what would be required to continue flights?
Yes, exactly.
I see. That's an interesting concept. I know that there's an enterprise of the nation that has expressed interest in doing a 638 contract across Navajo for the emergency medical flights. Maybe this is a time to pursue that initiative, and they would either contract with you, or you guys produce a joint venture, or it would be something completely separate. But I know there's been a lot of consolidation in your industry, and there are fewer providers as compared to, maybe just 15 or 20 years ago. That said, committee members, are there additional comments or questions right now? I think we have a solid base, and we could make a determination on some course of action, or we could postpone to have an internal discussion or speak with IHS. IHS, actually, are you on the line, Director So, or anyone from the area office who could speak to this issue?
Yes, this is Rosalind, Delegate Slater. I'm on the line.
Do you feel prepared to speak on this at this time?
I do not, except for the fact that I have looked in, and we are looking into this matter as it relates to the Navajo Area Indian Health Service, and I'm still looking at some documents, but I do not believe that we owe this company any funds for work that they have done for us.
Yeah, is this with Navajo Area IHS, or is this with the 638 facilities, or is it a combination? Presenters?
This is just Navajo Area IHS. I don't commit or pay for 638 activities.
No, I'm saying to Classic Air Med. Are they referencing?
Right. No, you're exactly right. It's for a combination of those, and I do want to reiterate what the doctor has said. We're not saying that you owe us money by any means. It's just that under the current reimbursement structure, there's no way for us to continue providing services during the pandemic, just with the influx of COVID-19 flights.
Okay. Director, so my request to you would be to investigate whether any funding, internal, from your original budget or the supplementary appropriations you've received related to COVID, could possibly be arranged to ensure that this service continues. I think that the subject matter requires something more to the effect of a work session, or maybe another conversation among IHS, the company, definitely get the executive branch and Department of Health on the line. And we're not going to have a solution right now, but I think the committee is committed to finding that solution. So, committee members, are there further questions?
Presiding Chair, this is Delegate Daniel. So I'm back on the line. I guess the main aspect is the fact that the rates that are set using Arizona and Utah, since that's where the patient had to be transported from, those rates is something that I guess within the departments and agencies of the United States government. So that's the other aspect I think we need to, I guess, explore and find out if there is such a way that those rates could be adjusted, either by the Secretary of Human Services or the department where Medicaid resides.
CMS?
I think that's one of the explorations that we have to do. Presiding Chair and committee members. I'll go back on mute.
Mr. Chairman, this is Carlisle. Just if I can provide just a brief explanation as well, clarification.
Yeah, thank you, Carlisle. I think maybe if you could speak to the state aspects that they're setting the Medicaid reimbursement rates, and so is there an administrative or legislative fix at the state level that we should actually be pursuing?
Thank you, Mr. Vice Chair. Yeah, I think a point they made earlier, Mr. Chairman, Vice Chairman, and committee members, is that in a normal operating environment, the rates of reimbursement, both directly from IHS and Medicaid, are predetermined on a fee-for-service schedule and capped at a ceiling rate that's determined by the states and by CMS directly. And so what they're saying is that in a normal operating environment, aside from the pandemic, they were able to balance out their operations because they were getting other reimbursement in their other business operating model from private insured individuals, and so they were able to balance it out. But again, because of from my understanding, because of the huge increase in COVID-19 cases and transports that they've had to make in the last few months, that model has turned itself upside down, and they're just no longer are able to continue to endure those financial losses just because of this surge and increase of COVID-19 patients alone. I think that one other clarifying point is that I know the council is continuing to debate and discuss the funding management plan, and so you might want to check with council. But in a scenario where there is a short-term contract possibility to cover only COVID-19 cases, those costs, from my understanding, would be allowed under the CARES Act funding for the Coronavirus Relief Fund, based on the criteria of the statute of funds that are incurred directly to COVID-19, and obviously you have a deadline of December 30th. So that may be a framework to look at for the committee to recommend to see if that's an interim solution to allow Classic Air Medical to, in this interim, continue to provide air medical transport to our Navajo Nation facilities. Because I think, just to be honest, I think seeking a federal or state fix at this time is a much longer process and will take a lot longer of an effort beyond, in their words, they're indicating that if there's potentially no solution, they will have to cease transport services on the Navajo Nation.
Okay. Committee members, is there further discussion or questions at this time?
I'd like to interrupt. My name is Justin Cruz.
Can you identify yourself, sir?
My name is Justin Chi. Am I talking to Mr. So?
This is Vice Chair Slater.
Oh, Slater. Yes, I have some concern with Navajo tribal employee government not following their policies and procedures, and this has been going on for a while. You know, I've tried to contact their supervisors and managers, which it's even gotten worse.
Is this related to the agenda item? Is this related to?
Oh no, I just got a phone call. I mean, I made a phone call and I got. That's why I'm just letting you know that I'm listening in, and I wanted to let you guys know my concerns.
Okay. So at this time, we are on, I think, agenda item 5B.
Okay.
Regarding the.
Well, I was doing a number and the access code earlier, but it was the access code was, I got the wrong access code, so I just barely, got in on this conversation. So I just barely got into the conversation now and just being informed,
Okay. Well, I appreciate you getting on the call and engaging with us. Let's set up a time to discuss the concern further, and then we'll go and proceed whether under a committee report or something separate.
Okay. I got to go to work right now anyways, too, so.
Okay, well, just real quick, Jimmy, do you have a pen and paper?
Okay.
Just email me. My email is carlslater@navajo-nsn.gov. And if you're a Navigation employee, you can just find me on the email. Pardon?
Can you repeat your email to me again, please?
Yes, it's carlslater@navajo-nsn.gov.
Okay, CARLSLAT.
And you can call the council delegate's office. But sir, we have to continue going on the agenda. So thank you. I'm going to call for the question. Mr. Mose, can you please do a roll call vote for Ms. Martinez?
Question?
Leonard, can you roll call the vote?
Yes, go ahead. All right. Honorable.
I thought we already had a motion. Do we have a motion established? Can you clarify?
I'm sorry, no, we don't have a motion.
Yeah, we do.
Okay, so we have a motion from Delegate Horno. Who seconds?
Paul Begay. Paul Begay, second.
Okay, second Paul Begay.
Okay, motion by Honorable Winika and second by Honorable Paul Begay. And call for the vote on Paul Begay Jr.
Delegate Slater?
Yeah.
I'm going to make a quick statement really quick before you go to the vote.
Yes, sir. Please proceed.
I want to understand this a little bit farther. You're with the flight people. There is no contract in hand, and you're upside down because of your private flights with insurance was covering most of the flight costs, and you are in Medicaid from New Mexico or Arizona and Utah. I understand the problem, the situation that's happening. I do also know that we can't afford to lose the service right now. And I guess you're threatening to quit service this Friday or next week Friday. I want to understand that. And So when we do get together and discuss this, it needs to be rather quickly so that we can keep them going. We don't know exactly how long this pandemic is going to last, but clearly we have a whole bunch of patients that are going to be needing to be transported. So I just think we need to get a date close to so we can work this out in a work session, but it needs to be done quickly. That's my comment right there. Thank you.
Thank you, Doug and Helena. Committee members, any further questions or discussion?
Okay. No questions.
Okay, good. Mr. Bose, can you please proceed to the vote?
Right there, Honorable Paul P. Jr.
Spring.
Honorable Carl Slater.
I think because I'm presiding chair at this time,
My bad. Honorable Pernell Helota.
One vote, Spring.
Honorable Charlene So. Honorable Charlene So. Honorable Daniel E. So.
I vote green.
Honorable S.J. Winika. Green. Chair, a vote of 4-0.
Thank you. I suppose we could have made it really interesting and had people vote against it too, and then I could have voted. But thank you, presenters. Carlisle, it would be good if you could reach out to Chair, myself, Ms. Martinez, and we can look at discussing some potential options on further communication, maybe formally or informally, and potentially getting either the Speaker's office or the executive branch involved and trying to come up with some solutions. We have a limited time here, and I appreciate everyone presenting concisely. We just can't devote much more time to it on today's agenda. Moving forward, we have item 5C, update report from Navajo Area IHS regarding Northern Shiprock area COVID-19 issues, and Director So is the presenter. Director So?
Good afternoon, everyone. Again, thank you, and it's nice to hear the Health Committee this afternoon. So just a couple updates, and then I want to go circle back to the Shiprock, specifically that issue. So far to date, Indian Health Service, the Navajo Area Indian Health Service has received $182 million and $250,000 into the area office. All of these funds have been distributed between the Navajo Area IHS service units, or the 638 programs, and the urban program. And these funds include they're all COVID-19 funding for testing, our response, CARES Act, CARES PRC, purchase and referred care, CARES M&I, maintenance and improvement, CARES equipment, CARES testing, and COVID reimbursement. And then we also received some funds for a prefab facility for Gallup Indian Medical Center, and I can talk a little bit more about that. But all of those funds have been distributed. We are expecting another pot of funds later this week, and so as soon as, again, our commitment is to get that out to each of the facilities within a 24-hour time period. I've also provided a written report to you as well, so that's what I'm working off of. As of today, again, these are IHS numbers only. These are unduplicated counts, meaning that even if an individual needed a second test for whatever reason, either for verification or whatever the situation might be, we're counting each individual patient versus the number of tests that we are doing on patients. So as of yesterday, we have 6,152 positive cases out of 21,866 tests. So we know that we have done far more testing than that, but again, we're trying to really track, and the reason we're looking at this data like this is so we can really look at how we can move forward to really determine how where we stand and so forth. And so over the weekend, we were able to use some reports that have come out of the Navajo Nation Epicenter that actually looked at testing and positive cases or the status of cases by chapter. And so it tells us within a 2-week time period, within a 14-day period, just where things are still hot. And that's where we are moving to now, to actually really look at how we can strengthen our testing strategies to really look at those hot areas that are still by chapter levels. And so hopefully by the end of this week, I have a team working on getting out a schedule. And this really goes to, I know Delegate Slater, you've raised this before, and there's a location in your area. Delegate So, there's locations in your area. Delegate Halona, there are locations in your area. So I'm hoping to communicate with you pretty quickly and what those schedules will be. We also want to make sure that we're communicating as broadly as possible, so we know, so our customers will know where and when they might be able to go to do some testing and so forth. But again, we're relying on the data that we're now able to use to be able to strategize and move forward on our ability for testing. Additionally, the other work that we're spending a lot of time on, of course, is the water infrastructure improvements. I'm not going to go through all of this information, but what our team has been tasked to do is really repackage all of the SDS needs that the nation that are known on the nation and that are being tracked by the Navajo Area IHS. So previously, you might have just seen lists and lists of pages of projects. Now we're looking at it differently to really try to make sure that everyone understands, including our customers, at the end of the day, where their projects are in the process. And so we can work through these a little bit better and so forth. So that information is there. You can see the 86-121 program funding for FY 2020. Then you look at the active projects. Again, I won't go into these in detail. They're there, and I'm able to set up or certainly open to set up a call with you in the future to go into these more specifically if that's helpful. And then the SDS unfunded projects are also identified there. So so what we've also been working on is responding to requests for CARES Act funding. And so if you look at there, I've asked my team again to look at these in phases of what we can do, what's the immediate fix, what's the immediate, what we can, again, work with our customers on in terms of what they can anticipate. So all of you, most of you know that Indian Health Service partnered with CDC to look at all 110 chapter water points. And in phase one there's $620,000. I believe I just saw an email come through that this money has been allocated to us by Indian Health Service. So these are the immediate fix. So we're hoping to get all of the ones that we can fix, either the 110 chapter evaluation, and complete those within 2-month period to get them working. So what this does do is at least provide options for our people to access water in a more timely, efficient manner. Moreover, the next phase is really talking about, of those 110 chapters, there's 37 watering points that need a little bit more work and a little bit more time. And so we estimate fixing those, a permanent fix, is $7.4 million. And then phase 3, we have identified projects there, 56 projects that we might be able to address through cisterns using, being able to use.
Ms. So, can you pause for one moment? Director So, can you pause for a moment, please? Folks on the line, can you please, I'm begging you, please silence your cell phones. We can hear people talking in the background. There's still really loud background noise. Sounds like someone's either driving or in a car. Thank you, Director So. Please continue.
Thank you, sir. So what we're trying to do again on phase 3 there is really identifying what is realistic, what can we do with regard to the workload that's already on our plate, and what can we help, or what can we facilitate, or what can we do And so we've identified, again, 56 more cistern projects that we believe will serve many people on the Navajo Reservation. We know that that's not the fix that we want, but we're also trying to be realistic in terms of what we can and cannot do. And then we also are looking at the 15 Shahasan funded projects. Again, these are just requests that we've had, and I'm trying to make sure that I'm consistent in messaging to all of the tribal leaders that I'm talking to. So we wanted to provide that for you, and then of course phase 5 would be all of those that are not met in either 1 through 4, and we know that there's still a lot of need out there. But what we want to be very realistic about is what can we do, and then even our proposal later today will be if we can't do it, what recommendations would we put forward to make sure that these water projects get done in a timely and efficient manner. The next topic I want to talk about are the isolation and the alternative care sites. We know that there are 3 sites within our area. One of them is at the Shiprock Service Unit, one of them is at Chinle, and one of them is in Gallup. And so we've been challenged over the past weeks to make sure and months to try to maximize the use of these facilities. Nonetheless, over the past probably 5 to 10 days, we're working to continue to maintain Chinle as an alternative care site. As of today, there's 0 census in there. But we do have a team, Rubicon, that is out helping the Chinle Service Unit when we get census in that facility. We have also worked with the Navajo Nation Unified Command Group to move the Shiprock alternative care site to isolation only, meaning, as we've talked about in the past, that we're really looking for isolation sites where people cannot find a location or cannot go home to self-isolate because there's other people in the home. We find that this is a more suitable situation. We've had far more success using the hotel rooms that we have secured. And then, of course, using the Shiprock ACS that could be turned, that we're working to turn over to isolation only. And then this program, Shiprock, is being supported by Samaritan's Purse. This is a volunteer group that has come in to help us staff and provide our staff a little bit of relief. We also continue to use the hotels. It seems to be that when we're utilizing isolation units, that our families, our patients prefer these probably more private rooms and sort of being able to be contained in these facilities. So we have upwards of 450 rooms that are available to us either in Chinle, Gallup, or Aztec. And then we're also looking at a facility in Kayenta as well to help us help people continue to isolate. I was just also notified yesterday that the Gallup Alternative Care Center, I suspect due to the low census, will be closing on Friday. So we'll see what that means for us in terms of moving forward. I also wanted just to add that we have some, in spite of everything that we're doing COVID-related, Northern Navajo Medical Center will be standing up a family medical rural residency program. So we're pretty excited about that. What this means is that we can actually have physicians training in our facilities as well. So it's pretty good thing for the Navajo area. I've also, on a side note, started talking with the Net College and other colleges nearby to stand up nursing programs for us because that, again, we still have a need in that area as well. And then finally, we have secured 6 public health, mental health professionals that were on the ground starting on Monday. They are located at each of our IHS hospitals to help our staff navigate and work through the mental health issues and the stress and so forth that we've all been challenged with over the past week. So I'm glad to be able to provide at least 6. I'm looking to secure additional 6. Again, this is really intended to be a support to our staff, our frontline providers that need that. I know that there were specific questions regarding to Shiprock. I suspect that maybe this might have been related to the isolation unit that the ACS turned into isolation. And the idea was, again, that that all of the healthcare system on the Navajo reservation could use these facilities, whether it's Shiprock or Chinle, and they get referred into this facility. So that might have been the concern as from someone that raised this as an agenda item, but we are making sure that the individuals that go either into an ACS or isolation unit properly go through a process, because we have to also evaluate each patient to see if they are able to go and self-isolate privately or somewhere. We still monitor them. There's still wellness checks that happen every day. Even the individuals that are in our hotels, there is a wellness check provided every day to make sure that, because we're learning that people's health status can change pretty quickly. We also have, through FEMA, 500 isolation tents, and so we're also giving these out because we know that some of our tribal members do not want to leave their homes and they would just prefer to be near their home. So these isolation tents are they came in from FEMA there, but they are fully stocked with food as well as any necessities that are needed to be able to be self-contained for the 14 days or the duration of a person's isolation period. So we're trying to maximize everything that we have with respect to the needs of our customers, and we know that there's more to come, but we are hoping that we're doing the best that we can. And then finally, I want to thank this committee for your ongoing support, and I'm hoping that at some point we can meet again face to face. But I also want to recognize my staff, the Navajo Area IHS. We have done a tremendous amount of work and continue to do that, and working very closely with hoping that this pandemic will come to an end soon. Thank you very much. That concludes my report.
Thank you, Director So. Committee will entertain a motion and a second to accept the report. Don't all jump at once.
Motion, Daniel So.
Second, Halona.
Okay, we have a motion from Delegate So and a second from Delegate Halona. Committee members, open the floor to discussion.
I have a really quick comment. I just wanted to ask a question, Mrs. So.
Yes, sir.
Good morning, Rosalind. How many? What's the total number? Do you guys have a running number on how many people were using your facilities when positive cases for the isolation and the isolation part, and also for them to get healed up before they have COVID?
Yes, sir. This is Rosalind. Thank you for that question. I apologize for not including that. We do keep all of the census information. I'm sorry I don't have it immediately in front of me, but I will send an addendum to the report that shows how many we have had to date in the ACS, as well as each of our hotels. We keep a census of who's in our facilities. If you recall early on, we had a lot of conversation about NCI. That's really where that model was kind of born from for using the hotel model. And there were times when we were up to 80% capacity in all of the hotels that we had available to us in Gallup. So it was actually very promising. In a call that I was on last week with the medical team and the New Mexico Department of Health, we have now integrated, at least with the support of the New Mexico Department of Health, we have now integrated social workers that will help our unsheltered tribal members maybe to find secure locations to live, or maybe treatment programs, or whatever it is that we need to do that. So we're realizing that as we move through this, how critical it is to strengthen our partnership, as well as make sure that we are addressing the whole patient as hopefully when they're ready to go home. I'll send that, Mr. Halona.
Okay, thank you, Rosalind. And then Oh, the school that, in Gallup, when you had the site also converted at the gym, is that, I understand there wasn't a whole lot of usage out of that gym. Is that the one that's going to be closing up?
Yes, sir. You know, I mean, one way you can look at it is that these isolation units were really intended, are built out to be for overflow or low acute care types of need. And I think when we go back and when we're able to really look at what happened, our medical centers were able to really move patients around appropriately, whether that was to move them out to higher level care or moving them within the facilities that we had planned to do. So it's a good thing that we were able to do that for each of our patients. It's difficult when you look at the cost and all of these other things that we're trying to do to keep the facilities open. Thank you.
Yes, it is. I understand you know, it takes a lot of work, quite a bit of work and planning. And I just want to say congratulations for the hard work, and thank you for all your hard work and running and doing these programs together. You know, it was very unexpected, and we knew something was going to come along, but thank you very much for your dedication, Rosalind.
Thank you, sir.
Questions, comments?
Delegates Begay, Wanika, So, and So. Anything to Director So?
No comment. Wanika.
This is Delegate So. Question to Director So. Is there any movement regarding your two letters to BIA Director Bart Stevens regarding the right-of-way on those 15 projects?
Thank you, Chairman. So I reminded him twice, including yesterday. He did respond to me, telling me that the letter was finally cleared. So I'm expecting that letter from my colleague, Mr. Stevens. However, I know that my staff have been talking with him, so I'm hopeful that we have some movement moving forward, and I hope that we continue to push, because as all of these projects are coming up now on the water part, we need to streamline this process, and it's extremely complicated as it is right now. So I'm still hoping we make progress. Thank you, sir.
Committee members?
Just a follow-up question.
Oh, here we
Chair
go.
Slater.
Yes, thank you.
The 15 projects are already funded or fundable. They're the ones that are shovel-ready?
Yes, sir.
And that's separate from the CARES funding?
Yes. That's not part of 1, 2, 3, or 4 in the report that I submitted to you.
Okay.
Just as a follow-up, Chairman or Delegate, so what I will do is give you an update, a written update as well on the loop to Delcon water line. So I'm trying to track down where all of these projects are at, and that's one that I'm tracking very closely, because we've got to get that project completed. The facility is on schedule. Actually, the facility is ahead of schedule right now. So I want to make sure that we're working that one as best as we can to make sure that the water doesn't come in after the facility. So I'll provide a written update on that too.
Okay, a follow-up question, Presiding Chair. Ms. So, I know that one of the senators called for a testimony by Admiral Wiyaki. Do you know the exact topic that the senator was asking for?
Thank you, Delegate. So I'm aware that the hearing is tomorrow, and as far as the specific topics, I am not aware. I'm sure I could dig it up in my email, but right offhand, I'm not aware of the specific topic. Thank you.
And another question. There is also the fact that I think it's Senator Udall that is also going to continue his effort to make sure Gallup, the new Gallup Indian Medical Center, would be secure the design and construction funds. Have you heard the status of that particular initiative?
It's not going anywhere.
Yes, sir. And again, I apologize for not including that in my report. So I am aware that we have reminded the President's office a couple times now to see if we can push that along one way or the other. Actually, not just the Gallup Indian Medical Center phase 2 site selection, but also the Palo Pintado that's ready to go and that's fully funded. And so in both of those instances, we were able to coordinate a call with the President's legal staff to help them better understand the process. And I believe they are now setting up, if they have not already, start negotiation for those under 638.
Okay. Thank you. I'll go back on mute.
Thank you. Director So, do you have an update on the defective PPEs that were delivered to the nation?
Yes, sir. And again, apologize for not including that in my report. So there's been, of course, a lot of work on our side to try to secure or to try to put the story together with regards to the N95 masks that were procured by the Navajo area IHS. Be rest assured, though, that none of those N95s have been distributed. They are still sitting in our warehouse, and we're working through the final steps of what we will do in terms of the next step for IHS, whether that is to return or whatever it is that we're going to do. But as soon as I get a final determination on that, I will share that information with the Health Committee. Thank you.
So nothing was distributed, but are you guys still out that amount of money? Were you made whole with non-defective, appropriately working masks? Or is this, we just need to wait and see? I'm not going to get an answer.
Yes, thank you, Delegate Slater or Chairman Slater. So we are working through that process right now, and there's been no final decisions that I can certainly talk about at this point. Thank you.
Okay, thank you. And then would you be open to having maybe a brief update call with the committee that just be focused on waterline projects? I'm thinking that there's a lot to discuss there, and I've asked for updates from OEH or from the Many Farms office on several projects, and I'm checking my inbox, and I don't think I've gotten the updates yet. It was promised to me by this past Friday, so I want to be sending you a listing of projects that are funded under Permanent Trust Fund or CISN and really need to advance, and I'm hoping that the coordination that's happening in the back end that you're doing is going to help see these across the finish line. Committee members, are there any further questions? Are you open to that idea about having maybe a a 1 or 2 hour call this week or next week, or maybe be shorter?
Delegate, Chairman Slater, absolutely. I have tasked my staff to again put this in a much more not necessarily simple, but certainly in a document or in a presentation that people can better follow. And exactly for this reason, I need and I want the delegates to be aware of where their projects are in the process, and including, as you know, I've been asking for help and trying to figure out how we can do this better. And it's my belief that as tribal leaders are informed and aware of the situation that we're dealing with, you can help me message that to our constituents, to your constituents, and more importantly, you can help me with the situations like we're talking about with the BIA and some of these situations that I don't have control over. So it's very, very important for me to set up some kind of a process by which everyone knows what the status of the projects are, so we can all be working towards the same thing, or at least have an understanding of where they are in the process. Thank you, sir.
Thank you, Director. Committee members, it's 1:11. Are we ready to proceed? Any further questions?
Doug Slater, this is Halona.
Yes, sir.
That phone call you were going to talking about, was that I missed part of that. There was going to be a discussion on the projects that were in line, and because there's 56 projects, 20 projects, and 15. Exactly where the location, is there a listing that we can get for that?
Director, so let's finalize the time with the committee, but in the interim, can you work on that more digestible report for us? And yes, that way we can have something to review prior to the meeting. I just feel that we've had some very positive discussions over the past couple of months, and it's a good time to regroup as a committee, as opposed to, say, NABI or the full council. Just to put that razor focus right on your program. Just kidding.
Delegate or Chairman Slater, I have that report ready to go. I will have it to you by tomorrow morning.
Okay, awesome. Please send it to Ms. Martinez and the committee.
Yes, sir.
Okay, great. That would give us an idea of, like for me, how many projects that might be in my area. That's what I'm really wanting to know. Okay, thank you. And I'm going to make a motion to accept the report. If there are no further questions.
I think you're currently holding that motion, and the second was Lamika. Mr. Rose, can you go to a roll call?
Yes, sir.
I stopped it.
Honorable Jr. Green. Honorable Renell Halona.
Halona votes green.
Honorable Charlene Stowe. Honorable Charlene Stowe. Honorable Daniel E. Stowe.
Christmas. No, I'm just kidding. Green.
Thank you, sir. Honorable Edison J. Winika.
He got my Christmas gift ready.
Vice Chair, 4-0.
Thank you, Mr. Rose. Thank you, Director. So the next report or item on the agenda is 5D, update report from Navajo Division of Social Services regarding shelters. Presenters, Deanna Neswood-Gushi, Executive Director and MDSS staff. I think I didn't clarify this correctly. I actually wanted the shelters to provide the update, and then we can have DSS do the response. Since we approved the agenda, saying the presenters were primarily the Executive Director for DSS, committee members, how would you like to proceed? Hear from the government agency first, then the shelters, or vice versa?
Presiding Chair, I guess, when we first talked about it, the issue was a new contract to start June 1. I'd like to hear a status on whether those contracts have been basically
approved and signed. As part of the report, it's up to the committee on how they wish to proceed.
Okay. We're of the same mind there. My thought was that we'd hear from the grantees and then hear back from the program on their concerns. Okay, committee members, if I'm not going to hear anyone, then we're going to proceed under that. From the shelters, I think we had Ms. Howard who identified herself earlier and some other leaders. Can we have an update on the status of your contracts, where they're at, and any other issues? Please be concise and respectful of the time. You definitely have been thus far, and I don't want to have you feel that we're not trying to address the issue, but there are other obligations this afternoon that many committee members have, so we need to keep moving. Ms. Hallwood or anyone else?
This is good afternoon, Chairman and members of the committee. Thank you very much for giving us this time. I know you guys are very busy. As far as Adabi and the other shelters, we have not heard from Navajo Nation Division of Social Services, and our contracts, it is going through the 164 process again. This is the second time we're being told that they've gone through there. Apparently they're at DOJ, and nothing. We're still waiting. We don't have a contract number to invoice on July 10th when the invoices are due. That's from Adabi.
So Adabi, no contract, no indication on when you're going to receive a contract. Other shelters, are you in the same boat?
Hi, this is Okaho with Family Crisis Center, Farmington, and pretty much we're in the same situation.
Okay.
This is
Ms. Hallwood, you had, oh, sorry, please proceed.
Sorry. This is Jessica with Roberta's Place. I did get notification that they were reviewing our insurance, and some other things are happening around the contract review process, and they're waiting for documentation from us to move forward.
Is that peculiar, or is that something?
It was a little bit peculiar. There was a request for us to include the nation on our insurance, which we hadn't previously had to do, which is fine. I've contacted my insurance agent to add them to our liability. But there was issues with the insurance being outdated because we submitted it so early last year for Mr. Pablo. So I had to get a new documentation and redo stuff that we had already done from the first contract.
Right.
Other shelters, is that a similar experience with the insurance issue?
Yes, this is Ms. Hallwood again. That was yesterday. We all received the same email indicating we needed, that DSS needed our insurance again. We've, just like Jess said, we've submitted these paperwork over and over again within the last 9 months, and they continue to ask for the same things again, and we can't. There's nothing we can pull out of our hats anymore. We've dotted all our I's, crossed all our T's, submitted everything they've requested for. I don't know what to give anymore.
This is Jessica with Roberta's Place again, and I would want to point out that during the COVID pandemic, accessing some of this stuff, not only does it take more time to get access to and get things added to insurance and such, but finding those documents and resubmitting and working around distancing schedules makes it difficult.
Ms. Nesler-Gishi, do you have an update on the status of the contracts? Do we have DSS on the line?
Yes, this is Emily with Battered Family Services. We haven't been notified on when the next RFP is going to come out and what the timeline is for that. That's something that we're very curious about, as last year they only gave us a week and then gave us an extension that ended on July 4th. So that way we can plan as we're planning our budgets, which is a year in advance. And so we haven't been notified of what that timeline is going to be looking like, or when the next RFP is going to come out and when we can submit it.
Thank you, Ms. Elton. On the call, is there anyone from the Division of Social Services?
Yes, hello. This is Regina Yazzie. I'm the Department Manager for the Department of Family Service. I'm on the call.
Okay. Ms. Yazzie, could you illuminate where the contracts are?
Okay, so we submitted a report this morning by email to the committee, and I will read off of what was submitted. So just bear with me as I read the report. The Family Violence Prevention and Services Act, FIPSA, authorized by Child Abuse Amendments of 1984, provides federal funding to help victims of domestic violence and their dependent children by providing shelter assistance, offering violence prevention programs, and improving health services.
Ms. Yazzie, can you pause for one moment? In the interest of time, and we know what the program is, we know what all this stuff is. You don't need to read this. We just want to know where the contracts are.
Okay, so
and
the
what's
contract,
going on. And if you're not allowed to read, if you're only allowed to read from that, then I understand. But
no.
We went over the contract.
So the contracts presently are remaining pending with DOJ, simply because of the insurance piece. The insurance coverage is what is still needed. And once it's all received from all the facilities, it will then move forward in terms of approvals and signatures and getting those completed with the finance department.
Okay, so the contracts are currently at DOJ, and have they given you an indication of when they'll be completed or moved out of the department?
Well, as soon as the contractors submit their certificates of liability insurance, those we have been, as soon as we get them on that day, we forward those to DOJ to be added to the packet. So as soon as we get those, then we forward them. But as far as I know, we're hoping by this Friday. So if we could get everyone's insurance submitted to us in an email to Rhonda, Gishi, and myself, then we can move forward with that.
So you don't have all of the shelter's insurance documents right now?
So far, as of yesterday, let's see, I believe we may have received two of the 7.
I think we have 3 shelters or 4 shelters on the line. I think all of them have claimed to submit that information. So
I'm not aware, but maybe they just sent it directly to Rhonda, and I wasn't included on those emails. But as far as I know, right now, I believe there are 2.
Chairman Slater, this is Brenda Sophie with Division of Social Services. I can provide clarification on that.
Thank you. Please proceed.
Thank you. Chairman and the committee members, my name is Brenda Sophie. I work with Division of Social Services, and I do assist Department of Family Services regarding these contracts. What had happened was initially we did get all the contracts together and submit the documents that, the insurance documents that they had provided. But according to our risk management, they usually review
the scope of work against the insurance that they have provided. So once that happens, then risk management will respond back to us to indicate is valid. I mean, not valid, but if they have meet the certain criteria according to their scope of work. So that was what was resent out based off of the information we got from risk management back to the shelters. So I believe we only received one document back. I think that was from Alice's place. So that's the only information we received back. So we're still waiting for the other information. All the memorandum was also routed to them, to the shelters, so they know what areas that they need coverage on.
When were they contacted regarding the insurance requirements?
We received document back from DOJ. I believe that was on, hold on. It was sent back out to them yesterday because yesterday was the day that we received the feedback from risk management. So that's what we got. So we forward all that information to them yesterday. Sure.
Thank you. Well, I guess initial feedback, the fact that maybe this existed within contracts but it hadn't really been enforced or advised, if the program is going to start making that requirement, that needs to be signaled ahead of time so that the shelters are aware of and can comply with that fact instead of doing it mid-process. It's counterproductive to bring it up in the middle of it and start requiring more documents that are, it's slowing it down. For these contracts, when can they begin their billing? Is it the day that it's signed or is it retroactive to a certain date? Is there anyone?
I can answer that. This is Brenda Sosi. It
Thank
will begin June the 1st. So that's when the billing will begin. Whatever billing that they're going to submit will start on June 1st and end on September the 30th, 2020.
That's consistent with navigation law. If it's signed after the fact, it can still be billed back to June.
Yes, that was the start date that was given was June the 1st.
Okay.
And Delegate Slater, this is Emily with Battered Families. As a collective, we'd like to get a legal opinion on that modification that the Social Services Division won't allow us to go back to October 1st to bill on federal funds. We feel that they're not following their own protocols. So if we can get a legal opinion that's written and saying that, these federal laws are being followed in the distribution of this money, that would be great. Thank you.
Director Ellison, thanks for that comment. At this time, I think that really the only remedy is to develop legislation to waive certain parts of the nomination procurement or the BIM. I think there's a bunch of things that might need to be waived in order to do that. I am supportive of it personally, and I think there are committee members who also feel similarly. So the opinion is good, and the committee can request that. Do we have Ledge Counsel on the line right now?
Yes, this is Ron Haven on the line. I'm listening.
Ron, so we need research, and it will require your coordination with the Department of Family Services at DSS to look into billing for when the grant was really made available to the nation, and if it'd be allowable for DSS to permit the shelters to bill back before June 1st. So under that analysis, if you could include legislative options as well, cover those costs that were incurred prior. I know that as a general principle, Navajo Nation, says goods and services have to be furnished and then you pay. And then you can't pay after the fact if there wasn't a commitment to pay for them. But I think there's a long-standing commitment to this program, to shelters, to their clients from the nation, and we have an obligation to fix this as a committee or a council if the executive branch cannot do it appropriately. Has Ms. Neswood Gishi joined us? Okay, Ms. Yazzie, thank you for the.
Chair.
Yes, sir.
Presiding Chair, I guess I agree with you, and it's just I guess part of the information the committee has received is some of the shelters have award letters. Basically, should have started their award process on October 1. So in that respect, that's where what you're requesting of legislative council attorney, Mr. Haven, that there be research to see if the shelters can build back to that particular aspect. Also, the award letter should also have shown, even the June 1 award letter should have shown that part of the requirements was to furnish the certificate of liability insurance, and even to state the dollar value amounts of that coverage, rather than just to say, hey, you need liability insurance coverage. We need that certificate. How much for each category within that award letter? So that is something that has to be very specific. And I'm sorry to say, it reflects back on the division. How are they working with the Office of Contracts and Grants? How are they working with risk management? All of it is kind of like, here, you got this money, but you know, after the fact, you need this document. After the fact, you need this document, and I'm sure it's very frustrating. And so, at some point in time, the division has to really get their proverbial act together. Thank you, Mr. Chair.
Presiding Chair?
Yes.
This is Carmelia Blackwater with Totonacia Shelter. If I may comment, we did receive the letter. It was by email, and it's asking for the contractor has not met the minimum insurance requirement set forth above deficient items for us as worker compensation with limits of 1 million, 1 million, 1 million. Additional insured for general liability and auto only. Waiver of subrogation for all coverages. And then D, the Navajo Nation shall be named as the certificate holder. So now we as the shelter have to go back to our insurance companies and tell them that the certificate holder has to be the Navajo Nation. And that is additional, days for us. And then it's saying that all of these will be reviewed. And so the way it's happened, the way the things have all, by the time we get all of this stuff in place and all the I's dotted and the T's crossed again, it's going to be past September. We will not have expended any of these monies from the Navajo Nation. And then one of the things that I had asked for before with the other managers for this fund was to get a policies and procedures developed so we know what we're working with and the nation knows what the timelines are. They're all written in black and white, and they know how these funds go, and then we know what we need to do. But that has never happened. We've never had a policies and procedures from the Division of Social Services. And then every time a new manager, a new division director comes on board, the rules change. And we're in the last quarter of this fiscal year, and we're still talking about how this money is going to be expended, how we're going to be able to get the funding for our programs. And we're in the last quarter, and like the gentleman said, that it reflects badly on the Navajo Nation. But in the end, we're the ones that are left without the funds to provide services to victims of violence. And in everything that I say with the Navajo Nation and the criminal justice system, there's no victim advocates to help victims of violence. There's none in the court system that I know of, and then in the law enforcement departments. Division of Social Services has maybe 3 or 4, and then us as nonprofit organizations, we provide that gap, and it's an essential services. We've not shut down. We've been operating 24/7. We've had people coming through our doors that were COVID positive, but we still have to provide these services because the federal funds that we use mandate that we stay open, and that's what we've been doing. Saying, just going along, changing the rules as they go, and that's the comment that I wanted to make and have you guys think on that and help us.
Yes.
This money is needed. It's not just for our salaries. But these are direct services that we provide to victims of service, doing counseling, doing transporting. We have to have people on staff to help them. We provide meals and doing bed night counts and all of the stuff that is needed. I don't know how you equate that to a single night at $100 per bed night count. No, and we're not going to make that bed night count in 1 quarter. So
I agree.
Thank you.
Honorable Slater, this is Mrs. Hallwood. Can I comment again?
They're asking for insurance, $1 million, to have all insurance.
Ms. Hallwood, can you please proceed? And everyone else, can you make sure that your phones are on silent?
Okay. Yes, thank you. I agree with what Cornelia said. We're nonprofit, and we do the best we can day in and day out. Our staff, they're in the trenches every day. This money has been available to the Navajo Nation's account back in February. Why is the Division of Social Service still holding on to it? They give us right here, here's the money, and then they say, oh, wait, give that back. You need another paperwork. You need something else. We have never been asked. We have submitted our insurance. I don't know what this is again. I responded to Rhonda Gishi. I said, I have nothing more to pull out of our hat again from Adobe. We serve people, we transport people, just like Cornelia said. We are frontline workers, and we transport victims who are COVID positive, but we can't say, no, you have a virus, we can't transport you. We're here to help them. 2:30 at night we respond. We get home until 5 o'clock in the morning. Then we're here again, 8 o'clock, doing the same thing over and over. We need these funds. We're ready to say, you know what, DSS, keep the money. We've given you everything. 9 months. 9 months. How many Navajo Nation government employees work without pay for 9 months? We have been doing that all this time. Please help us.
Thank you, Ms.
This is
Holland.
Shalene Stewart. Sorry, this is Shalene with Northland Family Health Center. We also receive funds. And I just wanted to mirror that. Again, we likely are not going to be able to spend down the funds that we were originally provided for 12 months in 1 quarter. It's not realistic, and it will impact our program as well.
Committee members, any comments at this time? I was really hoping that Director Nezugishi would be on the call today, because this is, I think, a catastrophic failure of the division to the Navajo people. And I'm going to be very frank about that. We've been talking about this issue since April in a very serious manner. And prior to that, I think informally, or even formally through questions at committee meetings in prior months. And, you know, this is at the division director's feet. And I'm going to offer some comments right now that are primarily my personal feelings, but I think are reflective of several members of the council, both on and off the HES committee. And I hope that they are conveyed back to the division director and ultimately to the president, because at this point, where is the president's office? Where is the help to our frontline essential workers? The people running the shelters? You know, that comment, how many Navajo Nation employees aren't paid for 9 months? I mean, that should be a gut punch to anyone who is working on this, whether they're an OOC, DOJ, or the Division of Social Services or the President's Office. It's unacceptable, and it reflects poorly of leadership. It cannot be the HES committee that is the only one who is trying to follow up on this issue and get some reconciling, get some answers, get some results. It's infuriating. And I'm at the point now where I think it would be appropriate for the council to consider a vote of no confidence in the director. I mean, that's how serious this is. And I hope that this is conveyed back to the executive leadership of the Division of Social Services. At this point, you know, there's just such a preponderance of facts and evidence and then just simple chronology to identify the failures of the program in delivering contracts that make sense or intelligible and go out in a timely fashion. The funding comes to Navajo. You know, we really need to investigate whether this should go to Navajo at all, whether there should be a third party that administers this funding on behalf of the nation to the shelters, and then maybe create some sort of self-regulation within that. Because the current model has proven to be ineffective and not going to deliver the results to the most vulnerable members within our Navajo society who need our help when they are facing some of the lowest and most challenging moments of their lives. And we cannot become, what is the word? Desensitized to the ailments that exist within our communities. And we as a government have an obligation to express to our people how important this program is, but how important our values are, and then actually affect them and actualize them within our government. So it is beyond time for excuses. It's beyond time for accounting or passing the buck. And I believe in the Division of Social Services staff, and I want the staff to know that right now, that this process, the 164 process, and the delivery of
contracts and grants out is something that more or less transcends individual actors within the Division of Social Services and requires the strength of executive leadership to move things along. If this was a priority, it would have been taken care of. If this is what a priority looks like to this leadership, then that's not acceptable, and that can't stand for the Navajo people. I mean, I know that everyone here understands the implications of what the lack of disbursement means to the shelters, what it means to those families who need safe housing, who need assistance getting to their court appearances, to protect themselves, their children. You know, why don't we just, I don't know. I'm very, very upset at this time. And I think that that is appropriate. You can hear it in the anguish and the pain of our shelter directors. So,
Delegate Snyder?
yes.
This is Deanna Nesugishi. I've been listening to your comments as well. Just wanted to let you know I am on the call. I also had a tribal consultation call at the same time.
Thank you for getting on the line. Did you hear me from the beginning of my comments?
Yes, I did. Thank you.
So at this time, we need results, Director. We can't have the shelters operating without the funding. We can't have this miscommunication and I want to go back to the discussion that we had a couple months ago, right? We asked you to meet with the shelters. To my knowledge, that has not happened. We asked you to clarify and provide documentation to them, really in the form of a legal opinion, but also with your signature on why the shelters couldn't invoice back to October 3rd. That hasn't happened. It's been orally explained, but not in a satisfactory manner. And then whether and to what degree, you could explore doing multi-year contracts to reduce the administrative burden on your program in delivering these services. But if the shelters are saying, you know what, forget it, we just can't deal with this anymore, that's not back on the HES committee's feet. That's not back at anyone's feet but the Division of Social Services. And this entire situation has arisen and occurred and continued under your leadership. And I'm asking you to fix it. I'm begging you to fix it.
Thank you, Honorable Delegate Slater, for your comments and the words that you have provided on behalf of the communities that all of the HES committee members represent. I do hear your comments and recommendations and directives as well. So just for information, I do have a department manager that oversees the all of the shelters, and so I do have that communication with the manager and her staff as far as meeting with shelters, the legal opinions, and so that's where there is a line staff who is doing that communication with the manager as far as doing requests for services with Department of Justice. So that is being done, and I did have discussion with the staff member with the next fiscal year to do the 3-year contracts. So those would be forthcoming in the fiscal year 2021. So we are having those discussions with the appropriate department. And so this is where I'm looking to have that continued dialogue, and I can go ahead and still meet with the managers to see what process is going forward. Thank you.
So can you commit
to a time when these contracts are going to be available?
Honorable Slater, I cannot make a commitment on the day. I believe some of the other shelters were speaking about the insurance requirements, and that is not a requirement from the Division of Social Services, but from Navajo Nation Risk Management as far as what standards are required. So we did have that notice sent out to the shelters.
Ms. Deswood-Gishi.
Not my request, Honorable Delegate Slater. It's where they require certain licensure or insurance coverages as well. And so that's where we're trying to do that communication. So we do have our document through the 164 review process. And so as soon as we get the required insurance coverages, which risk management is requiring, then we can proceed with that.
It's the responsibility of the program to ensure that documents that are submitted through the 164 process are complete so that they can move forward in a timely fashion. That includes understanding the stipulations of the professional services contract that says that the Navajo Nation must be insured as well. And so it's not acceptable to say that it's the requirement of the risk management department when the program should have all the documentation handled and finalized before it commences the 164 process. So again, we really need these to move forward. We're going to have you back this next Wednesday, but we're in June now, and this cannot go on. This cannot go on. And it's almost like the facts don't matter at this point. There's too much evidence pointing to poor communication, this, that. It doesn't matter that risk management has this policy. It matters that your program delivers at this critical time to our faith in the Division of Social Services. I'm talking about my faith and the shelter's faith and their faith. So, committee members, if there's no further discussion, I'm also going to open it up. Sorry, if there is further discussion, I would like to open it up at this time. Otherwise, we can proceed with the agenda.
Delegate Slater?
Yes. Delegate Lona, please proceed.
Yes. Look, I just want all your assessment there, Delegate, because, this was before us in April, and 6 months, 7 months is really too long. Ms. Gishi, if you have your department manager that's supposed to be on top of this, this should be a priority for that, get taken care of. I understand the 164 process, it moves slowly, but I went there and did another different project on the 164 process, and yeah, I stepped on a few toes, but I got the job done, and some of the projects approved that I needed to get done. I think your manager needs to get and all those programs. It doesn't seem like it's getting done through that person. So that's just what I just wanted to make that statement that something the project manager that's supposed to be taking care of this is not really doing her job, as far as I'm concerned. Thank you.
I'm on to Honorable to
Is that Director Deswood-Gishi?
Yes.
Please proceed.
Thank you for assessment and comment. With manager, we did have a long-term manager in that position for many years. And so the manager was no longer with Department of Family Services. And so the new manager, Ms. Yazzie, did start May 16th. And so that's what I've been trying to do. We are working collaboratively in this area to address, and you're aware of other areas of concern. An example, the nursing homes that we had to address again, when we do have managers, I do have, that they're going to reach what their response does not happen, then yes, that's why I do have to get involved, such as the prior manager. So we will make this pretty, I guess one additional comment regarding the insurance. The shelters have been turning in the same insurance coverages. It's not ever been an issue. So the shelters have submitted their packet with insurance coverage. That's where it was all submitted through the 764 review. Done similar in prior year. So there's new coverage, and so that's where we're trying to do that with the shelters. We're just, thank you.
Committee discussion, are you ready to vote? Thank you. Delegate, so are you requiring to speak? To the call, speak. Would you like to take chair of the meeting again, or still another?
I can like the response, then I can start presiding again. But I guess the main thing, Ms. Nez, issue is the fact that issues, well, it is really presiding chair stated it succinctly. It comes back to your management and administrative style. So the main thing is as soon as you found out that there was new additional money value requirements on the liability insurance coverage, that should have went out as an alert. Okay. And so to just basically kind of like, oh, we can take care of it tomorrow, we can take care of it next week aspect just doesn't suffice. And that's the part that this committee is really concerned about. In other program issues, we know that the committee was adamant in those other issues. So here we are at a new one, and some of the explanation you've provided just will not suffice as a good answer to the satisfaction of the committee. And there has to be that better action to make sure that the shelters get their money in a timely manner. Get that document signed. And that's the extent of my comments, Mr. Presiding Chair. Thank you.
Yeah, Shania. Committee members going once, going twice, going 3 times. Mr. Mose, will you please proceed to a roll call vote?
Mr. Slater, we need a motion and a second. So, Mr. Alona, I'll motion. Accept the report. Second.
how long, sir?
Okay, in that case, Honorable Halona, do you want to take over the motion?
I can motion that, yes.
Okay, so committee members, we have a motion and a second to table. Do we have Honorable Slater back on the line? Okay, so Mr. Mose, a roll call vote, please, on this tabling motion.
How long will it table this legislation, sir? Next meeting.
It's
Beverly?
Mr. Mose,
Yes, sir.
this would be the second time it gets tabled.
That's
So
correct.
it's no longer, so that aspect of how long to table, then it's no longer a valid legislation once it's tabled twice.
Yes, that's correct.
Okay, call for the vote.
Mr. Roll call, Mr. Mose.
Aye, sir. Honorable Paul Begay, Jr. Honorable Paul Begay, Jr. Honorable Carl Russell Slater. Honorable Pernell Halona.
Green, one of those green.
Honorable Charlene So. Honorable Charlene So. Honorable Edison J. Winika. Honorable Paul Begay, Jr. Honorable Paul Begay, Jr.
I have a quorum again.
Honorable Carl Russell Slater. Honorable Charlene So. Chair, we lost quorum. I'll have 2 votes.
Yes, so in that aspect, committee members, we lost quorum. So we are out of the committee meeting. And let's class it in the because of technical difficulties.
Maggie Benoli.
So in that respect, then we'll just leave it as be, and Ms. Martinez.
Yes, sir.
All the remaining
log back
agenda
on.
items. Who's that?
Can you repeat that, sir?
Okay, so we lost quorum. Ms. Martinez, how do all the agenda items, how will they be treated?
The following agenda items will be forwarded to the next meeting, next regular meeting.
Okay. So committee members.
I'm having technical difficulty too. My phone's going off.
Okay, yeah. Committee members, so that particular legislation that was going to be tabled, then just proceed to the next one.
We'll proceed
to the next agenda. So that'll be how we handle it. So what committee members, we lost quorum, so we're no stipend for this meeting. So we just jump on to the NABI work session.
I've been here all morning.
Hello, Chair. This is Delegate Brown. So our legislations will be moved to the next regular HES meeting, correct?
Yes, on April 17th, 10 a.m.
June 17th.
I mean, June. That was one of those back to the future type of thoughts. Okay. Thank you, committee members, for having acted on some of the other items. With Ayla, so we'll call back in on the NABI work session. I'm getting off the teleconference now.
Leonard? Leonard? The tabling motion